la setse le kgathetse mare ke batla gore ko ntlheng ke le dumedise ke le leboe gore le kgonne go fitlha this morning a ke re batho ba Val re ka moara Sebokeng mare kopano e ke a batho ba Val as a whole a ke re so rato le gore batho ba Val pharaphare ba kgonne go fitlha I'm sure ba bang ba tla nna ntse ba tla a ntse re tsweletse pele ka kopano ya rona a ke re mare before re tsena into our formal program go na le ntate re mo kopile gore a tle fela a tlo fana ka tlhaloso gore legislature e ke eng because not everybody understands or legislature ke eng a ke re or e sebetsa jwang legislature so ke mo kopile gore a tle fela tlo le fa tlhaloso mo bokhutswaneng fela hanyane mare before a tla mo ko morago kwa ke re la bona o na le mabokisa mantsho a ke re la bona mabokisa la mantsho le ke di translation booth a ke re rona motlhomo re ka bua ka English mare mo mabokising a le go na le bomme le bontate ba ile reng ba na le kitso ya dipolelo tsa rona tse di farologaneng a ke re South Africa has got 11 languages so re batla re kopano ya rona e utlwelle and you utlwisise ke o mollo mongwe le reng o teng ka jeko a ke re so ba ile re matlo kopa ba tlo nna le tlhoko ya ditshebetso tsa bo mme le bontate ba le go morao o emisa letsogo fela ke re ba tlo le fa ntse tshwana kana le e tshwana kana le a ke re wa utlwella fela o tsena mo channeleng ya teng if re bua English go no translate ka Zulu Sotho Setswana Sepedi Sevenda Shangaan a ke re and Afrikaans for those of you who are motlhomong ba e batla ka Afrikaans di channel tsa teng di tsamayang for English on na channel number 1 for Afrikaans on na channel number 2 for Sesotho Sepedi Setswana yon na channel number 3 a ke re tse di nyalane tse Sotho Sepedi Setswana and then Sizulu Xhosa isiNdebele channel number 4 Sevenda Stronger channel number 5 and then rena le batho ba sign language a ke re mara ke batlo moranta to wa sign language wa modimo ke batlo re le re bontshe gore hona le motho a nang le tlhoko ya sign language na o teng a teng fona bjanong a ke re o teng a teng so re tlo nna ntse re botsisa mo tsamaisong ya rena ya program gore hona le wa tlhokang sign language ho botlhoko o tsamaisa matsogo e le gore a ona motho wa sign language a ke re le matsogo a na le go kgathana so ke bo mama ba tlo tlhokang translation yeah emisa matsogo a lona ko dimo and then ba tlo le tlisetsa di booth tsene ba tlo le tlisetsa di machine tse yeah emisa matsogo kopa re ba thuseng ko morago ka machine eo ne re ba thuseng ka pejana re kgone go tsamaisang lenaneo la rona mara ba tšha bona ke nana gore English e ba itse lo sa e utlwe bile mara something wa se utlwa a ke re dilo tsela ke ra se ngata ene ba gole ke batlo ikeletsa boikopelo dilo tse di na le di-tracker di na le di-tracker tsa National Intelligence Agency so ha o thoma gore o tswa ka yona ka mora bofelobo ya o tracker and wa tshwara maximum sentence a ke re la itse mo South Africa yeah minimum ke 15 years ha o tsamaile ka ntho imagine ba o tshwaretse fela gore tsamaile ka ntho 15 years so ke kopa gore ha o ya toilet o e tloela fela mo stulong a ke re o skwa le bala wa kra o founetse ke mme go lapeng gore ke ntate o bore ke tswile ka yona ka phoso ya trongo a ke re la utlwa ba gole so e tla ntate o ikitsisi o tlo fana ka tlhaloso gore legislature e sebetsa yang o hona le ntate o molena ke mo kopile gore a tlo le tlhaloso gore di petitions di bereka yang e tla mbontate a re start ka public participation o re fefela overview legislature ke yeah no yo re tlo tla mo yona yo lefelo le bagolo ha ntse re le ka mo re le declara gore ke lefelo leo ka reng ke palamente ya rona akere according to rule 56 ya legislature. So maitshwaro a rona re tlo batla gore a tsamaisane le maitshwaro a rona ha re le ko bokagelo ba legislature akere la utlwa. So maitshwaro a rona tshwantse nne o ka re ko legislature a re rase a re goelle a re bui a re batla o bua something re emisa matsogo fela akere la utlwa. Ke a leboa.
Good morning. Dumelang. Sanbonani. Okay. Thank you very much, Chairperson, for the opportunity given to me. Gizo nenzela a presentation on what is the legislature, what is in the legislature, and why is it important that you should know what is the legislature and how iyenza kanjani ukuthi your life gets better as we are here. The legislature is an institution la kwenziwa khona imithetho, is the institution where laws are made. Ne? That mandate of the legislature is taken from the constitution. All in all, the legislature has 4 mandates. Mandate number 1 is to make laws. But the legislature does not make new laws every day, The legislature yenza nama amendment to the act. Uguti act ibe easy if mhlambe act it was not easy to be implemented. Yenza uguti act ikwazi ukuthi implementeke kalula noma act isebenze kalula. Government which is responsible for uguti implement ama acts ikwazi ukuthi iwa implement. That is the amendment. And then we move to the second mandate of the legislature. The second mandate of the legislature is oversight. When we're talking about oversight, you will understand that you've got the legislature and you also have government. Those are 2 different institutions. The legislature is led by the speaker, and government in the province is led by the premier. The premier is responsible for 10 government departments in Gauteng. You will have, for an example, the Department of Education, the department that we are here with, today, which is the Department of Health. Then, in the legislature, you will have the portfolio committees. That's where you'll have to understand what is oversight. The legislature will give budget to each and every government department. Then government department will be expected to come to the legislature and account and report to the legislature on the program and progress that is done based on the budget. Let's say, for an example, the Department of Health. The Department of Health has different programs. Like, for an example, one is to make sure that hospitals and clinics, they run professionally and effectively. So it is the responsibility of the legislature to call the Department of Health to the legislature to see to it that the services are given to us as the public. The services are given to us as members of the public. And also, the legislature will also process, or the portfolio committee will also process the acts that are, or you will also amend the acts that are concerning health issues. Like, for an example, yesterday, the legislature was having pre-public hearings, and I understand that even here in the Val and in other regions of Gauteng, there is an amendment that is before the legislature on petition. My colleagues know that Diana is going to deal with that. But that act is amended so that it will be easily implemented, or it is enhanced. Bayenze ukuthi yenziwe ukuthi leyo act ibe right, isebenze kahle. So And then we move to the third function of the legislature. Third function of the legislature is public participation. As we are all here, we are doing public participation because the Constitution says if there are laws that are made, the legislature must go to the people and seek the involvement of the public, of the relevant stakeholders into that act. Let's say it's an act that deals with health issues. Then all the stakeholders about dealing with health will be called to the legislature and make submission on that bill. That is public participation and public involvement. The legislature make the citizens of Gauteng to be involved in the governance of their life, and also in making sure that the laws are made, and those laws, they are going to make sure that us as citizens of Gauteng, we benefit from them. That is public participation. And public participation, during public participation, we'll have the public hearing where you, as members of the public, you will be asked to come with a written submission sometimes. If you have read the bill, and then you come up with the submissions, you submit it to the committee, then the committee will process the submission. Also, we are called into a public hearing, and then in a public hearing, you also expected to do the verbal submission, whereby you, as public, you make your input on the bill during that meeting or during that public hearing. And also in the legislature, the legislature has made sure that there are programs which are run by public participation and petitions unit. For an example, during the month of June, you will have youth parliament where we call all the stakeholders, all the youth of Gauteng to come together and give them topics, researched topics, and then they will discuss those topics. They will discuss those topics. They will discuss those topics. Sorry. They will discuss those topics, and then they will come up with the resolution. Those resolutions will be taken into the house. Like for an example, this year, as you will know, that we had elections, but we had one sector parliament which was involving senior citizens, wherein we called all the senior citizens to come to the legislature. We gave them topic from the bottom of my heart, of my mind. One topic that was discussed was the issue of wills. How do old people make wills for their houses? They discussed that. We'll get people who are experts to come and do presentations so that people will benefit. And then I'm happy to say to this house, to this meeting, that the resolution next week Tuesday, they will be tabled in the house such that they will go to the office of the Premier, and those that affect the province, the office of the Premier and Department of Social Development will be able to process them. And then thereafter, because we are saying Zigube a talk shop, and thereafter we'll also do a feedback and call all those people or their representatives to come to the legislature and as a report back on what has been implemented and what is not implemented. If they also involve national governments, it will be processed and taken to the National Council of Provinces in Cape Town, so that if it affects the areas where the provinces do not have a mandate to deal with. And then the last function of the legislature is to make sure that you'll understand that we've got the national government, you've got the provincial government, and then we've got the local government, of which normally you call them municipalities. So the legislature function is also to make sure that there is synergy amongst those three spheres of government. There is synergy amongst those three spheres of government, which means all those three spheres of government, they work, they talk to each other. If ever there are programs that are going to be engaged in, and I'm sure even in this meeting when we were invited, the municipality was informed that the portfolio committee will come to this area in Sebokeng, and they are aware that the portfolio committee is here because it is the responsibility of the legislature to make sure that there is synergy amongst the three spheres of government. I don't know whether there is anyone who's got a question. Because of time, I will not be able to deal in depth with the functions of the legislature. But there is a person who is responsible for Citibank. There is a person who is responsible for City of Johannesburg. There is a person who is responsible for Tshwane. There is a person who is responsible for West Rand, and there is also a person who is responsible. Let me just say, in all the 5 regions in the legislature, there are people who are responsible for making sure that there is public awareness, the public is taught on the functions of the legislature, because you cannot comment or you cannot be involved if you are not aware of what is the function of the legislature. Chairperson, thank you very much.
Yeah, Norle Wheeler. I get a little more than that. Nafana got hello, sorry. Ntweri is under legislature again. I get na going to nalo verigisa manzo maki marbo legislature parliament. Ke parliament alona ka mora province ya rona ya Gauteng. Province nngwe le nngwe e na le parliament ya yona. Ke re la utlwa bagolo. So legislature e bereka o tshwana fela le parliament. Re sheba tsamaiso ya manane wa ditshebeletso tsa mafapha golomente. A ke re le utlwile. Gona le romo mare ke re senoto teane o ka ro tshabile. Oh, ke batla le tlhalosetsa gore ha le na le ditletlebo le fitlhella yang legislature gore e kgone go thusana le lona gore ditletlebo tsa lona di fitlhelle ko tshwantse di fitlhelle ko teng. A ke re ga ngata re fumana gore bongata ba lona le na bokgoni ba re ha le na le dillo e be le gore la utlwala. Ke re so hona le committee ka mora parlamente ya lona ka mora province e le gore e thusana le setšhaba. Committee re bitsa re ke petitions committee. A ke re so ntate o le mona mo pele mo o tswa le ko committee eo so re mo kopile gore a tle le ena le tlhalose gore committee e bereka yang. A ke re la utlwa ntate.
Ke leboge modulasetulo ke boe ke dumedise le maloko a committee ya health ya maphelo le boitekanelo ke dumedise le lefapha la rona la dipholo le boitekanelo ke dumedise le lona baagi ba Gauteng. Dumela. Nna ka lebitso ke Senoto Teane ke tswa ke le ko unit e re bitsang gore ke Public Participation and Petitions Unit. Re dira le bone borre Njabule Buthelezi. Unit eo e na le mafapha a farologaneng, what we call sub units. E ke tswa mo yona re bitsa gore ke petitions office ya dingongorego. Go na le bontate Njabule ba dira public education and outreach. Ka mogare ga dipeke tsa lona ka mo la bona go na le di pamphlets. Go na le sub unit engwe gape re bitsa gore ke public education material development, curriculum development. Every nna gape le public participation. Bao ha re ba bitsa loosely re ke batho ba ba dilang ka mobilization. Ke bona ba ba dirang gore le tlo tsa karolo mo legislature as part of the mandates tse e leng gore tshwantse re di dire go ya ka constitution ya rona. Ke so ke tlo le nopolela ga bonyanenyana gore ha re bua ka petition bagolo re bua ka eng. Okay, it's not moving. So ha re bua ka petitioning bagolo ha se ntho e leng gore o no tsoga mo mosong legislature e re batho ba ka nna ba tlisa di-petition. Go na le ntho e bitsa gore ke legislative framework. Re boa gape re lebeletse le temana ya goreng le tsantse le tsaya karolo. Le tsaya karolo mo go eng? Le tsaya karolo mo go eng? Ga re dira melao, including le yona budget ba gaetsho ke molao. Hence re bua ka the minute o utlwa lebitso bill ke molao o akantsweng, a proposed law. So ga re bua ka budget ko ntlheng e simolola e le an appropriation bill ka mo go tlo tsamaisiwang go kgaolwa tšhelete go ya ka mafapha re nang le ona a le lesomo mo provinceng. Akere go fitlhelela e phasiwa in the legislature, in the house, gore mafapha a yana le yana a tlo kry-a bokana go ya ka diprograma tse e leng gore ba di identified. Okay. So gantsi ha re na le nako gore budget about 3 hours to cover these areas extensively so fela because of nako le purpose ya meeting a ga je go ta etsa fela go godimo re gelle fela ra re engwe ya ditsela tsa gore le akaretse gore le tlotsa karolo mo tsamaisong ya letsatsi le letsatsi ya government ya lona ya Gauteng go ira tsere bitsa gore ke oversight le lona le tsa karolo mo oversighting ba gaetsho ga budget e phasitswe department e rile ya re tlola agela clinic for example ebe clinic e sa agiwe o khona gore o tlise ngongore go legislature gore no re sepisitse X Y and Z ke lefapha le le rileng kapa ke masipala yaanong ntho ga e irega o khona o tlisa ngongore gore e lebelle re feletse re le go tshwanetseng. So re tsama re lebeletse constitution ba gaetso constitution ya bua section 17 ere ona le tokelo eo ya gore o ka matcha o ka piketa o ka demonstrate ebile gape o ka tlisa le di petition fela ha ile re ilo matcha kana o ilo protesta o tshwanetse o dire so peacefully and unarmed. Otherwise, if you act beyond or outside the law will take its course. Agara ukwan. So hora hore ga o batla go matcha tshwanetse o applyela permit ya go matcha akere. So section e o ke yona e fileng effect to petitioning for lona le batho ba Gauteng. Fela legislature e be ere molao o wa rona o mogolo mo country ha o tlhalose gore petitioner go iragetseng ka mabaka a mafeng. Legislature e be ere a re dire molao o specific o tla re kaetsang o re guide gore re petitioner ka eng ha go iragetse eng akere. So ko ntlheng re nile le molao o wa Gauteng Petitions Act number 14 of 1998 o ileng wa fetolwa akere ntate Njabule o boletse ka go dira melao akere law making. So ha re dire melao fela re a bua re fetola ha o tlhokega ha ile re molao o ha o sa tlholo o tlhokega ra o tlosa. So re bua ka law making, amendment of the law and repeal of the law akere. So molao wa 1998 14 of 1998 what petitions wile wa fetolwa ha jana re mo Act number 5 Gauteng Petitions number 5 of 2002 o eleng gore le ona re mo tseleng ya go fetola ka moso re tla be re le go Sirman go Hammanskraal last leg ya di public consultation mo molao o fetolwang re fitile mo Sedibeng re le mo ka di 31 tsa October batho ba tshwaela gore ba ikutlwa yang ka molao o fetolwang o di karolwana tseo tse di fetolwang. Okay, so a re lebeleng gore petition ke eng ba gaetso. Normally by petition in terms of Cambridge, a petition is a document signed by a number of people requesting la utlwisisa o underline requesting ha re ra demand. We don't demand, we request services or certain services from government. All right, so the act itself molao wa rona o reng or petition is a complaint, request, submission, representation addressed to the committee. Which committee? The petition standing committee in the legislature by a petitioner or petitioners. Why get by petitioner petitioners? The types of petitions that you farologane. O ka submit as an individual, always. Ne? Two, le ka submit as a group. Fela go tshwanetse go bana le maina in support of the petition. How many names? Our act is not prescriptive. High restrict to how many. You cannot collect 5. But in other countries, like Scotland, you are required to collect a minimum of 100 signatures before it can even qualify as a petition. Let alone looking at the issues which are petitionable. The number itself will qualify it first. Then they look at the issues. What issues are you raising? 2, okay? So that will tell us the 4 mandates of the legislature. So ha re fetola molao go ra gore re mo law making. Ha re boa gape re la akaretsa re irang public participation. Ke ka ile gore ka di 31 tsa October ne re le mo Sedibeng as part of the 5 public hearings on the amendment of the Gauteng Petitions Act 2024. So now oversight and scrutiny, in simple terms, is monitoring and evaluation of government programs. Re bua gape re dire melao, re fetole, re tlose gape sa tlhokege. Re dire public participation, meaning tshwanetse re le involve ga re tsaya di decisions tse eleng gore di a le affect. Even if e ka ba molao wa national, o tshwanetse o tle mo go rona through the NCOP. Then le consultiwe your submissions kana se tebele se latlhetse mo tla boela morago as a submission by Gauteng. And then e bonna gape le cooperative governance. So o hopole gape gore na le makala le mararo a puso. National, provincial, le local. Again. At the same time, there's a difference. Legislative, the executive, the judiciary. Those are the 3 arms of the state. Rona really legislature, including national parliament, the council ya gago mo masipala wa lona Emfuleni, ke the legislative. Masipala wa gago dirang o dira di bylaws. Rona re dira melao le nationally dira melao. Ke ka ile gore ha ona le molao o tlang go national, o tlo tla mo provinceng ha ile gore wa re ama. Through the NCOP, ke batho ba re emetseng go. Again, the executive, premier, president, ministers, MECs, executive mayor, depending on the size of the municipality, leading MMC the executive. Their role is to implement the law. Meaning, the legislature will demand that the services has a role ya rona. Role ya rona ke go monitor gore the services tse di tshepisitsweng ke the executive di a diragala. La yuko. Ano ha re pasitse molao karolo ya rona e fella fo. The executive must implement. The judiciary must then interpret. So rana the legislature re ba dira molao. We are lawmakers. The executive are implementers of the law. Ke boletse ka budget ka re lona ke molao. So ha re pasitse budget, re lo rona fella mo re tla wa gape re lebella in terms of monitoring and evaluation gore a ba dira se tshwanetseng ba implement. Ga ile gore go hongwe o feletsa le re yana go iwa ko court. Antsi ke ra sky ka Domestic Violence Act. National would have done so, o tlile mo province ra di tshwaelo. And then e bo betiwa kana le lwa go ntlong mo nga betsa mo. O totla go ga go legislature. Domestic violence. Ba o betile. O to ya go kae? Ko police station again. E wela go kae go executive. The implementers of the law. It means SAPS will investigate. Once we finish an investigation based on the evidence, also statements and so forth, they hand over to who? The NPA again, who must then prosecute. Then the judiciary will then have to interpret based on the evidence presented and arguments from the lawyers, again, including the mitigating factors at the end. So like one Rebecca, we make the law, it ends there. This one's the executive implement the law, it ends there. the judiciary must then interpret whether you are guilty or not, and what sentence must be meted to you. So, we have separation of powers. We are not a referee and a player at the same time. We are guilty or not. Okay? So, Constitution, Section 17, on a Section 115, 118, public participation, 195, oral evidence that must be presented to the committee. And then, a specific to say, you can submit based on the following. So, so in the main, the purpose of the act is for you to provide you with the right to submit a petition. So, we fulfill section 2, the Bill of Rights. Again, you have the right to petition. So normally, harira workshop, because this is what tells us what the petition is. If anything falls outside this, then it cannot be a petition. I get like a petition. We make laws, it fell more. They interpret, they implement. Okay? So well under the legislative authority, meaning in this instance, the legislature or council in the municipality, then it can be a petition. Secondly, if it relates to the work of the executive authority, meaning Gauteng provincial government, that's only Premier or MEC, including also the entities of those departments, then you can petition. Three, if we're under, let's say, MEC in Komoralo Hoko, Ugile Atla engage a Lelona, let's say PISA 1, 2, 3, then at the end, you can petition. Four, if you are under supervision of local government sphere, meaning Maspala Wahaho, Emfuleni, Kanayona district municipality, Yasidibe, you can also petition. Why realo? Because in this instance, there are powers to call or summon, subpoena, anyone from this, including in the legislature as well. So, in summary, we say, if it is service delivery related, or it pertains to a policy of government, you can also petition, but this policy, it's no longer relevant. The more we are currently, you can petition and challenge a policy. Okay? Now, the committee will refuse. And I want to air must. The act says must, not may. Must refuse to consider a petition that falls outside those four: legislative, executive, MEC, local government sphere. Must. Not may, must. Also, if it concerns a matter pending in a court of law, let's say separation of powers. If it's now at the court of law, we cannot entertain it. Also, if it relates to now a sentencing by a criminal court of law, now about we went through the processes, now we are sentenced. Then you come to the legislature, right? Please revoke or amend that sentence again. We can't. If it's a Baisana commission of inquiry as well, we cannot address it. Separation of powers. Now, what happens? How is a petition? That's why Motohata are get petition go legislature. The first question, I get who would sign on chairperson Letwalo, now chairperson in health. He's also a former chairperson in our petition standing committee in the 6th legislature, previous administration. So, do you have what we call an acknowledgement letter? Meaning, in terms of the regulations, 2016, we are bound. Letter A acknowledging, airing, yes, agree the submission. There and there within 48 hours. How clearly personally, what we call a walk-in, there and there. How submit a real acknowledgement letter? A process as well. From there, we summarize the contents because sometimes lengwala love letters it didn't tell. So we need to now sift out the issues tse leng gore di relevant. We call it a summary. Right? I reisa go committee ya petitions. They deliberate, engage, and then decide whether to adopt or reject. That is the powers conferred on the committee. They can adopt or reject. Okay? Now, in terms of adoption, it comes back to us, administration, we take it to the relevant authority. E ka ba tswa e le department or masepala or dilipedi fela yalo. Okay? And then we give them 20 working days. 20 working days, not 20 days. 20 working days, meaning Monday to Friday times 4 is the whole month. In often cases, they don't submit a report. We remind them, we give them another 2 weeks, 10 days. Failure, in most cases, we remind them again. At the end, if we don't get the report, or we get the report but you are not satisfied, we then call for what we call a petitions hearing, whereby you are invited, the department or municipality is invited, the committee plays an intervention role or facilitator of the session, and then we engage with the hope that we'll come to an amicable solution. Okay? So in a way, the committee and the act itself, they are opening up those doors. I know most of you will come and say, but hey, hake ya go masepala or ke ya go department thing, how to know diary full, so and so is not available. Baba mbabal rabare no ya legislature. Again. So at the end, the committee has powers also to close on the matter if bafila or no, they have tried and they've reached the ceiling, they cannot entertain the matter anymore. They will close it whether you agree or not. All right? But remember on early recourse in terms of making an appeal, the appeal does not come to the committee and ourselves as that mean. It will have to go to the speaker's office. We avoid the issue a referee and a player at the same time. Because you might feel or height like or happen. Reganara who disadvantage. So another setup, the speaker will then set up a sort of an interim committee to deal with the matter of appeal until by fate. We can only come in when they're requesting information or documentation to that effect. Okay. So, how long it means it's a legislature or a reception or batla official petitions? Kana or Garamo the number in Zeo, lady email it Zeo. So now number WhatsApp, we also communicate in WhatsApp because WhatsApp I efficient matters or Conaloro the documents. Kelebo Hemudula Stulo for Nagor filling yona as petition standing committee.
Agre le mutluile ntate teana agere. Re ditse presentation or le gono e itse gore a le na le mathata le itemogelang ona. A ile gore nga shebane le tsamaiso ya ditshebeletso tsa mafapha golomente. Le ya go kae agere. Legislature e bereka o tshwana le public protector. O gono e llela. Agere mo Setswaneng or mo Sotho mana le gore kgosi thotobolo yo la matlakala. Ke ona committee ya di petitions, ke committee ya di complain, ke committee ya kopo, o kgona go ikopela. Ora rona re le badudi ba mo Sebokeng, re bona ka re lefelo la rona le faile man. Re biletse municipality e tlo fanang ka tlholoso gore why o le faile so. Akere, ana kere le bona re faile mo ntle mo la o tsena mo. Oro le kgona go ikopela gore ai clinic ya rona ke nyane man. Re kopa gore re tsenye petition le re biletseng department ya health ba re tlhalose gore mare why ba sa rahele clinic nyane nngwe tona yana or sekolo akere mokgomo kgotsa maybe ditsela or mabone why bona so ntwe e sebedisana le di municipalities tsa rona e berekisana le mafapha otlhe a golomente a re batle lo tse private go ra re batle motho a tlanga lo tse private a re ne ke adimile motho tšhelete a mpatele legislature ha etsene mo akere or ntate o ntshile o nna le mme o lwa ka mo next door mo a re tsene mo akere la utlwa bagolo ya nna re tsena fela mo mo di-programmeng tsa government. Mare ntumelle mo sebakeng se ke kope mokhanselara. A ke re la mitse mokhanselara wa lona. La mitse a ke re. Ke tlo mo phagamisa fela a re letse fela welcoming fela address. Sambane re metse mokhuduthamaga wa rona wa tsa maphelo a ke re. Re batla gore a re simolola program a rona be le gore mokhuduthamaga o teng. Gore a le na le dipotso le di ise ko ena. A ke re lebile ditsena. Maro ba teng ba bang ba tsamayang le bona bontate Slepe bontate Makola and others. Mara re batla gore ba bue pele before a fitla. Batla gore protocol a rona gore kopano tsa rona di tswalla pele ha re invite le mokhuduthamaga a ba iponatsa. Ore a le na le dipotso tse di ye ko ena. A ke re la utlwa bagolo. So mme ma mokhanselara setšhaba sa o ke se.
Morning, everyone, gentlemen and ladies. Akil dumedise hape batswadi kaofela. Ba teng mona le tlile le tlo mamela kopano ena ya rona ya legislature ya health department. Batswadi ke a welcome kaofela. Ke welcome di officials tsa rona. Ska ba le teng ba tlo bua le rona. Ene batswadi ska ntate sa tshulo hore let's a petition. Rona, ke rona tlamere se petition. Ha holo zone 14 mona. Ward 31. Ha ke re kopane le Ward 30 clinic ya rona. So re na le mathata clinic. Ha ke re la tseba batswadi. Ha ke re la tseba batswadi re na le mathata clinic ya rona. For a long time clinic ya rona batho ba dula ka ntle letsatsing moyeng ha dipula dina a bana plek ya o dula. So batswadi ke kopa let's petition for that clinic ya rona because inyane haholo la o kena ka hare o kena batho ba 5 kapa 6 ke phasishi fela ene clinic ena ke a khale ile teng zone 14. So ne re kopa o legislation le na ke a ba kopa as a council hore ba re assist ka clinic eo. It's a pity hore MEC wa rona so fihle tlamele a fihle ebile ne ke rata hore a ka yo bona clinic ya rona hore kae cause batswadi khale ba tlitlhiba ka yona hore inyane that clinic. So ke thabile batswadi a le teng le khona o botsa dipotso tse ngata le utlwile ntate hore ba ka khona ho thusa le ka dikgwere ka ntho tse ngata fela. So ke lebohe he. Thank you batswadi ke leboha.
Alala mokhanselara alala. Yeah. Ayo. No makhanselara man na go ngara ba introduce mo setšhabeng setšhaba go ra re mitse. So wena ke bona ba o itse ka. Gore ke batho ba hao batho ba o itse. Ba go lo ro simolla program a rona ne. Ke na no MEC o tla nna ntsa re joina re le mo tseleng. Ntate Slepe o tla tshwana go tla mo pele mo di presentation a ke re di teng. Maybe re dile ka di presentation maro tla ra advisor or re simolle ka efeng. A ke re we've got 2 presentations. So o tla ra advisor re tlo simolla ka efeng. A ke re and then MEC a tla hopefully o tla fitla in time. Or a kgone ho utlwa di input tsa setšhaba sa rona. Kopano e ke setšhaba or setšhaba se tlo ipega si bue di kgwetlo tse le gore ba na le sone ba ntshe se le gore se mo makgwafong matsapa le gore ba itemoela mona mo ditleliniking tsa rona mo dipetleleng tsa rona. A ke re gore ke ona ntho e re tliseditseng mo kopanong ya rona. So bagolo ke tlo kopa a ke itse ntate Slepe ro simolla kae. I serve with a smile. Re tlo etsa presentation eo and then a re fetsa re tlo tla ka e nngwe again ya patient complaints. Okay. We are going to take those 2 presentations. But before ba fitla ba lefapha se se re tlisitse mo ke hore naga ya rona e sebetsa ka molaotheo o re bitsang rona re re ke constitution a ke re na le constitution e lwanetsweng ene ke nana hore motlhomo ho na le ba bang ba lona mo ba ile hore mo nakong e fetileng le nnile karolo ya dintwa tsa hore naga ya rona e nne le tokollogo a ke re ene ke ka mokgo re ikrang ka jeko le re na le tokomane e re bitsang re ke constitution and ha o e shebisa tokomane o kry le hore ko section 27 e bua ka hore motho mongwe le mongwe mo nageng ya rona o tshwanetse hore a kreye ditshebelotse tse di shebaneng le tsa maphelo ka mokgolo rong ho nolofetse a kere and ditshebelotse tso tshwantse di nne le hore di na le quality kwa kry le hore o tsene mo lefelong la bophelo wa kry le hore ha o thusiwe sentle a kere la e utlwa bagolo mara ha re tswella pele golomente ya rona e betla ka mananeo a rileng and one of them ke ntho e re bitsang re ke the guideline tsa patient experience of care a kere ka 2017 ne sambane le nna ke le go lefapheng la tsa maphelo di guideline tse di re tsona mo ditirisong tsa maphelo or mo faneng ga ditiriso tsa bophelo lefapha la tsa maphelo tshwantse le make sure gore ditshebelotse tse di kgone go fitlhelela ke mang kapa mang whether wa bereka kgotsa o bereke a kere so access to health services ebe di rape re batla gore batho ba rona ntse ba ya mo diphapusing tse tsa maphelo ba kgone go fitlhelela ditlhare se kwa kra o tsena mo tleliniking kgotsa o tsena mo sepetlele wa kra ba ra nna re na le Panado fela a kere e le gore wena motlhomong o tlile e le gore o na le chest discomfort a kere so access to essential medicines mo ditleliniking tsa rona le mo dipetleleng tsa rona tokomane e be bua gape gore mare mo mafelong ao tshwantse be le gore go na le ntho e le reng e kgone go thusana le setšhaba gore maphelo a bona bolokesege patient safety a kere and then e nngwe gape ke gore tokomane e bua ka the values le di attitudes tsa di staff tsa rona a le ka nna la nnanyana bomme values and attitudes tsa batho ba le gore ba fana ka ditshebetso tseo a kere bo sister kgotsa bo doctor so mongwe lo mongwe wa lona le gore o iponatsang ko mafelong a le gore a tlhatlhobo o tshwantse be le gore wa amogeliwa sentle a kere o fiwa ka guidance gore hey a ile gore o tshwere ke bolwetse bo processa rona ke a kere ene bofelo bongwe le bongwe ba tlhatlhobo tshwantse bo nne le ntho e le ba bitsang ba re ke patient rights charter a kere le na lo e bona le tsena mo ditleliniking ba e beile mo mabotaneng patient rights charter le na lo e bona re a sanga le bona a le itse la e tseba ne ya e teng a le tsena fela mo ditleliniking tsa rona ntho e tshwantse nne teng ke yona e fanang ka tlhaloso gore ditokelo tsa lona ke tse feng gore ha ile gore motlhomongwe sister Emma a bua le lona sentle le kgono kenya complain a kere or motlhomong a la tshwara sentle ke maitshwaro wa doctor rileng le kgono tsenya complain a kere la utlwa bagolo mara tokomane a e tswella ko pele e bua le ka bo di-infection prevention and control gore lefelo leo la tlhatlhobo tshwanetse le make sure ga o fitlhile ka molona o se ka kry-a le gore o tswa o le worse off. They must make sure that they follow relevant protocols. A ke re la e utlwa bagolo? Relevant protocols. And then ko bofelelong tokomane di-guidelines tse tsa rona tse di bua le gore mafelo a ditlhatlhobo tshwanetse a shebe ntlha e ya patient waiting times gore ha o le patient o fitlhile ko tleliniking ka 7, the maximum time e le gore o ka e dula o emetse gore o boniwe ke fe? A ke re ke fe? So the presentation tse di tlo fiwang tse di buisana le tsona dikgang tseo. A ke re, and the reason why that is the case it's because really committee rona e le gore e shebane le gore department e tsamaisa yang ditshebelo tse or mananeoa re ithare re ultimately if le fapa le gono etsa gore ka nnete di-guidelines tse di saliwe morago re tlo nna le ntshwe re bitsang re ke better health outcomes. A ke re tse di nang le mono wa se se buisiwang ka mora constitutional rule. A ke re better clinical outcomes, meaning tlhatlhobo ya lona ke e le goreng e manontlhontlo e tseneletse. A ke re a se e le goreng ke o fetisiwa fela gore no motho o le re mmone ka speed a re batle yao. A ke re and then hape gore di-suggestion tsa lona le tsona di kgone go utlwellwa a ile gore motlhomong o tsene ka mo tleliniking e rileng le bona monkgono ba ntse ko ntle ba nela ke pula gore ba etsa ke letsatsi mole o bo tsenya suggestion or recommendation dilo tsa di a tshwanno fella mo moyeng. A ke re tshwantse di recordiwe di saliwe morago ko pele kwa le wena o kgone go fiwa feedback gore kganyele a o re shebile karabo ya teng ke or nana gore di-measures tse le re tla di tsaya rona re lefapha ke itse. A ke re la utlwa bagolo? So ke tsona dilo tse le reng rona re le komiti re shebane le tsona gore lefapha le etsa eng o thusana le setšhaba tsa rona o thusana le morafe gore ditshebeletso tsa mananeo a tsa maphelo a tolame gore they are in order. A re batle tleliniki e le goreng e functiona o ka re ke spaza shop. Tleliniki nngwe le nngwe e na le di-protocol tsa yona from how o fitlha ko teng o itsebisa, from accessing your file, from being advised. A ke re la itse ntho e re bitsang batho pele principles. Batho pele principles e tsamaisana le yona lenaneo le la ntho e re bitsang re ke patient experience to care or kgotsa yona patient satisfaction. So ha re le tšhaketse yana mo bofelong bo ka jeko mo Vaal re ba tlo etsa assessment le lona. Assessment a ke re ga se re le one. We want to do this assessment jointly with yourselves so that you share with us your experiences in the presence of the department. What are your lived experiences in respect of your interactions with the health establishments in this area of the Vaal? A ke re so re ba tlo utlwa mo lona a re ba tlo wa zoom or no this is what is happening because nako nngwe re kry-a di-report from the department tse le goreng di kgabisitswe di nice. A ke re mara kry-a le gore ha re utlwelela setšhaba presents a different report. So that is why we resolved ourselves or let's go to the Vaal and engage with the residents of the Vaal, the health constituency of the Vaal, about their lived experiences. So much time will be spent here listening to all of you. I get it. You are going to get an opportunity to raise all the issues that you want to raise in respect to the management of these clinics, in respect to the coordination of health services and delivery in this region. I get it. I want to check, Mo Councillor, whether we have got anybody here who belong to clinic committees? Is there anybody while or clinic committees? Only 2 of you. So there's only 2 people. Is there anybody who belongs to a hospital board in this meeting? No one. Yeah, tshwantse le lona le ikamanya akere. Ba le ba rona ba di clinics committees a dumela mobile. Because lo lona re batla gore le tlo fana ka bokae hore what are your experiences in the clinic where you are designated. Again. So re tlo kopa bo mme, akere la ba bona ka re ke matshwini. Ba tlo ikitsise gore ke bona bo mang. Ba tswa go kae. And then ba fana ka presentation. Again. Ba le ba rona ba di clinics committees le sa nang go mora tla le tlo nna mobile, ne. So bo mme re ke le fe monyetla le ikitsise. Again. So akere la bona go mora MEC ya rona ke yona e fitlang, so go ra re manage tsena go pile. A re reng halala MEC halala. Halala MEC halala. Ya lanza le late akere. Mara mo halalisa fela hore ke MEC ona le nnete. O khonno fitla go re tlhompa batho ba vala. Akere. MEC Yeah, the MEC Nanza communicate or starta go Steve B Kobe like. So re thabela gore MEC ya rona go no fitla. So MEC, we were already at a point where we were about to take a presentations. But maybe let me hand over to you so that you can just do an overview. We have explained the purpose from the national guidelines on patient experience to care. We linked it up with Batopele principles. We spoke about the constitution. We spoke about, why there's a need to assess regularly and why these surveys are there. But we're going to hand over to you to just give an overview. Thank you very much.
Thank you, Chair. Phambili ngeGauteng legislature phambili. Siyabonga kakhulu ndifuna ukuxolisa Chair andimeli enye into ndiyabonga kakhulu ngoba undamkele uninikeze neopportunity lokuthi manditsho uba ndivelaphi ndixolisa enye into ebendiyoyenza ndiyakhumbula ubuke waya necommittee Steve Biko. So now we're doing a follow-up on some of the equipment that we should buy, including the capacity of the personnel that should utilize those equipment, especially radiographers and other people, including the personnel yethu. The capacity of sister is shorter kakhulu ezibhedlele ngiyayazi omama bakhona apha bayayazi inhlupheko abakuyo. So those are the things that now I'm doing monitoring after your visit, Chair, that you went to these institutions, especially the area oncology, Chair. We have some work that we are doing, but now I wanted to make a follow-up. How far is the progress on that? So, Chair, ndizawuxolisa kakhulu ngoba indeed andinideleli but ndifile ukuthi mandize nami bekufama ngale nani mawuqala ngo-10 o'clock lo meeting leyo. So that was the delay. Chair, ndiyayazi uzawuthi mase kupresentwa sikuxelele kakhulu ukuba how far have we moved kwindaba yethu ye-patients care in our hospitals and in our clinics. We're trying, Chair. It's not easy. But siyayazi bafuneka senze lento eninidayo as a committee. So we'll definitely expect that to do a presentation on the work that we are doing, including on your side. We'll accept your questions, but the support that we're getting from the members of the legislature. We're happy to be in these meetings because that's where we're able to get exactly the first-hand information that we are getting from the citizens of how should we behave as a Department of Health and how should we assist you to make sure that we work together as a team in servicing the citizens, Chair. Siyabonga kakhulu, Nkosi. Yeah, Samantha that is presenting, yeah. Sanbonani, Samantha. Oh, sorry, we are not alone. And the COO, Undate, Dr. Slepe, Ukona, and the team from the office. But they will present, and then COO and the other teams, they will take the questions, yeah. But I'm not alone, yeah.
Let's load the presentation. Do we have a presentation?
Yes.
Yeah, if we can load it. Yeah, thanks.
Dumelang, Bagolo. Le kae? Okay, kopa fela gore re itsukutseng ganyane ne. Zizojika izinto wena ukhalelani wena ukhalelani
Are my sister.
wena ukhalelani
Are sister. Are ke batla re tsene mo programming. Are tsene mo programming ka presentation. I'm sorry to do this, we're a bit delayed. So I want us to move swiftly with the program. Remember what the precinct of the legislature. So ordinarily in the legislature, singing would not be allowed. I get it. Maybe after the session, when we have a formally agenda meeting, will we allow that singing? We don't want to excite anybody, otherwise we'll be undermining the prescripts of the rules of the legislature. But thank you very much. Let's follow through with the presentation.
Dumelang bagolo. My name is Lerato Monghaye from Gauteng Department of Health in the province. More directorate that is called Human Resource Development. I'm with my manager, Ms. Samantha Ngindi. Can you please introduce yourself?
Good morning, everybody. Good morning, everybody. How are you doing? Good. So, thank you, Chairperson. I think I don't have to do the presentation. You covered everything for me. So, I'll be to the point. Right. So, to complement the quality assurance within the Gauteng Department of Health and Wellness, we have launched the I Serve with a Smile campaign. And this campaign, the key objective is to reinforce the brand of the Gauteng Department of Health, but also pushing a mandate that we don't just have a brand, but the Gauteng Department of Health becomes the first employer of choice. I think the tone has been set. We have 12 minutes to do the presentation. So why the I Serve with a Smile? Why? It is a response strategy. And this response strategy is to address patients' complaints, minimize unnecessary litigations, tackle complaints promptly, but most importantly, is to foster a healthy working culture. I cannot expect my professional nurses to render a service if we don't deal with our attitudes internally. Who is involved with this process? It's everybody within the ecosystem. From the MEC, our executive principal, from the HOD, right down to the porter, right down to the EPWP. It includes the community, the patients, labor, media, and most importantly, our medical or nursing institutions. We have gone to the extent that when we talk about a trainee doctor coming into our institutions, they might have been introduced to what the healthcare is all about, but we want to ensure that we reinforce the back to basics. Now, the I Serve with a Smile isn't something that was just thought about overnight and say, hello, let's do the I Serve with a Smile. No. It is underpinned by policies, legislation, and frameworks. And like the chairperson had made mention, he spoke about the Constitution. right? So the Constitution gives us guidance as to how we should be treating our patients. And it articulates the patient's right to access healthcare services. There is a variety of policies that feed into the I Serve with a Smile, but also as we reinforce back to basics through the I Serve campaign, we also get ready for the National Health Insurance that will be implemented soon. Just from a softer side look and feel, we also look at the patient's care policy. We look at our health service standards. We talk about code of conduct. How do you treat the patient? Training and development, and also the ongoing performance evaluation. I know my colleague will delve into the performance evaluation. It's not just the incumbent, but it's the entire ecosystem that is taken into consideration. Quality of work life. Why quality of work life? We need to make sure that if Samantha is a professional nurse, it's not about her just coming to work, but if she's not performing, what support do we give the individual? It also reminds us around the national core standards, and we all know that there are 7 standards that talks about the patient's rights, the facility and infrastructure. It talks about governance. It talks about clinical support services, and also the patient's safety, clinical governance and care. I'm not going to go through this. The patient's right, it reminds the professional nurses within our institutions in Sebokeng around why they have chosen the profession, back to basics, the doctor's pledge and the oaths that they have taken. But here comes the most important ingredient, the principles, our Batopile principles, audit, code of conduct, and ethics. And we're going to zoom into it. My colleague will zoom into it. Batopile principles are important. Audit is fundamental within our clinics and hospitals. We need to acknowledge our patient. We need to introduce ourselves. We need to indicate to the patient how long it will take. We need to explain to the patient what the procedure will be, but most importantly, also thank them. And we have to do it with a smile. And when we say a smile, citizens, is to say that, I'm not saying show us your teeth. It's lovely, we can see your beautiful teeth, but it must come from the heart. It must come from the head. And it must be executed with hands. So we are saying you need to be passionate about why you are in the health sector. So on that note, I'm going to hand over to Lerato, and she will just reinforce certain elements around the Batopile principles.
Thank you, ma'am.
Don't sing. I know you can sing.
Okay. Yes. So, bagaetso ba ko lapeng, Batopile principles is I serve with a smile. So we are trying to remind ourselves as colleagues why we are serving the community, why we are serving our people. We need to consult. So consultation is very important. We need to get feedback why we are doing ourselves. Since I serve everything, is there a change early bona? And the service as well. From the gate, we start at the security because it starts from the gate. So access to information. As the community, you need to have information. What is I Serve with a Smile? When you see I Serve with a Smile, you imagine what's quite a. And courtesy as well, colleagues, is very important because kebotu. So you can give a good service, mara. If you don't greet people, E jwalo akere. And also information must be accessible. We need to redress. Ke yone ke bua ka yone, we need to go back to the community. Where can we improve in what we are doing? And we need to be open and transparency and value for money to see if people that are employed at Gauteng Department of Health ba etsa mosebetsi. Please. And aided. Aided is very important because you need to know the person that is serving you. So you acknowledge a patient high from the gate, and also the duration. You need to know why, how long are you going to wait for you to open a file, and also you need to explain, and also you need to thank a patient for coming and say, see you on your next appointment. And this is our supporting pillar, to say we need to be cultural sensitive, language diversity, and you need to be genuine when you serve people, and you need to have patience and empathy, and you need to be adaptable and flexibility, and we need to appreciate diversity because we are different, and we need to also have a positive problem solving, because we understand there are other challenges that we are facing, so we need to be flexible when solving. And I Serve with a Smile is a brand. It's not only a movement as well, because as a person, you are a brand. And what kind of a brand are you? Because a brand is a legacy. When you go to buy a car, you know between BMW and Mercedes-Benz, which brand do you prefer? You know the specs and everything. So I Serve with a Smile is to make sure that our brand as Gauteng Department of Health is on point, is high quality. And also our identity. So we have acronyms that we are living by, and it's not going anywhere. So SMILE, and this one is SMART. Whatever that we do, we must serve, and it must be motivated, it must be achievable and time-bound as well. And serve, we need to serve. To give a service, must give an excellent service, must have respect and value and empathy. And yes, can you please? Then smile. So smile is not only by showing your teeth. So smile is for service and motivation, integrity, and leadership, because we are all leaders. As we are sitting there in our community, we are here for your community. We are all leaders, and we must also, by all and to have empathy. So integrity, whether you are seen or you are not seen, you must do things ka botswerere. You know when you're doing something wrong. So I Serve with a Smile is there to remind us, you only do good when the MEC is here, but how to patient treat. So yes. And you want to continue? Okay. So how do we do this? So the I Serve with a Smile was launched in September. So we do the blitz. We go Petlele, we do blitz, we introduce I Serve with a Smile. Then we on board from EXCO. Because if you on board but the EXCO is at the next, so they need to be on board as well. And the brand I care, so now in the same program because it's the same thing. So now it's I Serve with a Smile. And we also have the virtual meetings when institution phone to say, you know what, our institution at this moment, complaints we need to bring I Serve with a Smile on board. So we come in, we have the sessions, we take them step by step. And Mosidi Beng, we were here not long to launch. So thank you very much, CD Beng, for launching I Serve with a Smile. And also team building, because I Serve with a Smile cannot be done by only one, the community as well. When you go to your clinic, obokra services in right, but we've launched I Serve with a Smile. So why are we deviating? Why are we not doing the right thing? So it's reminding us to go back to basics because we know how we are supposed to treat the patients. Because most of the patients, they are the medications because of the service. So now when I think to go back to get my treatment, I'll rather stay at home. So communication ilona iteng to say we have I Serve with a Smile. Then the working teams we are here and also as the community going forward. We must say program by bizang I Serve with a Smile, and you must also be part of it because this program is our program because we are trying to fix all the challenges that we are facing in our healthcare. It's not no MEC, Loruna, we have a role to play as the community and also reminding us to say, but Mona la senya. And the exco like it starts from the top, then then now we are here in the community to say I Serve with a Smile this year. Yes.
As we conclude and hand over to quality, where are we? Like Lerato made mention, we have launched the program last year, November, so the baby is 1 year old. We have onboarded institutions and also ensured that there are lead facilitators or trainers within the institution to ensure that we always incorporate this in our orientations and inductions. And how will the department ensure consistency and implementations? Is that, like I've made mention, we cannot do this alone. It is a collective and we collaborate with our quality assurance team, and we also have our tools that we use to ensure that we measure the impact when it comes to any complaints and also provide feedback on that. So on that note, I'm calling upon my colleague that will look at the quality process. Could you kindly project the other presentation, please? Quality. Time is ticking. You've got 15 minutes.
Not 90 minutes. No, give her so that she can change the slides. I need to concentrate on her. Okay. To the chairperson of the Portfolio Committee on Health, members of the provincial legislature, you acknowledge the Honorable MEC for Health. MEC, we are pleased to have you here. To the members of community, ke tlo bua Sesotho fanda galena ke Mosotho akere o re tla go utlwa kaofela ke bona bonkgono mane batho ba baholo le bontate moholo ba tla ba utlwisise ntho tse re tlo di buang ka tsona jwale ka se re utlwile dibui tse buileng pele ho nna ba re bontshitse melao kaofela sebetsang dipetlele le ditleliniking kaofela hore lona as members tsa community le tsebe hore na di rights tsa lona ke eng le di obligations tsa lona ke eng ke melao e mengata re ka qala ka constitution ya naha e le molao o moholoholo wa motheo re tle ho National Health Act e le molao o regulating ditleliniki le dipetlele kaofela tsa private le tsa public ka mora mo re tla ho white paper on transformation ke pampiri e yentsweng hore re tlowe ka mogho health ne fuwa ka teng ka nako ya gale ho tla mmusong o motjha ka tsela e health tshwantse e fuwe ka teng ka hore ho fapane re tle ho public service legislative framework ke melao kaofela e regulating hore na kaofela di institutions tsa government hore na di sebetse jwang re tle ho the national patients ethical rules and for health providers ona ke molao o regulating hore na tshwantse re itshware jwang rona batho ba fanang ka tshebeletso ho lona. Ka mora moo ya ho qetela ke National Patients Rights Charter hore na di rights tsa hao ke di feng. Ha re le batho ha re ithuteng haholo Patient Rights Charter ha o tluwa lefapheng la bophelo bo botle e teng hohle mona. Sepetlele se seng le se seng clinic e nngwe le nngwe order e nngwe le nngwe ka hara sepetlele e na le Patient Rights Charter. So ha re ithuteng hore na di rights tsa rona ke di eng hobane ha re sa tsebe di rights tsa rona ha re no tseba le haeba di a tlolwa di hatakwa ka maoto di rights tsa rona hobaneng ha re di tsebe. O ke wa responda mo nthong o sa itsebeng. Next slide please. Boholoholo ka jeno ke tlo le bolella ka key objectives of health sector kore na ntho e ntseng hore hobane le health sector ke eng me ya pele e re to respect the patient's right. I get ka bua ka di rights so tshwantse re di hlomphe re tle re hopole hore government ke lona so di rights tsena le di tshwere go lona tjena tshwantse le di sebedise hore le re fahlolle rona ba fanang ka tshebeletso re mona jwale ha o sa ya ho ha o sa tsamaya ho ya ka di rights tsa hao. Ntate o re boleletse hana qala hore ho na le dilo tsa bo di petition tsa bo eng re rutehe hore na ke metjha efeng e re ka enkang ha re bona hore ditshebeletso tsa rona ha di tsamaye ka tsela e rona re batlang ka teng. You have that right. Ya bobedi, to resolve problems and satisfy the concern of the patients. Ho tlameile hore ha ho na le bothata bo bo bonang o tshwantse bo shebuwe. O na le right ya ho complaina hore bothata ba hao sepetlele clinicing kae o na le right ya ho complaina. Mme ke tlo le ruta hore na mona ditshebeletsong tsa rona o complaina jwang ka bana ke a tseba lona ba hae ba mona vale mona le rata media le rata o ya modi ho thwe ke eng di radiong empa le sanka metjha ka hare ho qala ho leka hore le bone ka hare na le ka thuseya jwang. So fanda ga ke tlo le bolella hore na tshwantse le tsamaise jwang ntho ena hore tle re tsebe hore na re etsa jwang. Ya boraro ke hore okay I'm sorry. No, not yet. Yeah, okay. Let's stick to this one. To provide health service managers with means to exert lessons. Little le hopolo hore hantse le re fahlolla ntse re ithuta le rona tsatsi le leng le leng hore mara jwale ena baahi ha ba khotsofala ka tsele re tsamaisang ka teng e re bone hore na di alternative tse teng mo ke di feng tsa ho improve akere issue here kore lona tshwantse le be satisfied wa bona ha o tlile hore experience o banang le yona sepetlele clinicing kaofela o tshwantse o utlwe re ke sebeditswe hantle ka hobane ke di institutions tsa lona ska hane se ke buile. And then to ensure fairness for staff and patients alike. Tshwantse o be fair e ska re ha o fihla dinane mane o bane ntate mona ka hore o tlisitse ngwana ha yena ngwana ha ke mo counselara jwale ngwana ha o sa fitiswa ka pele empa nkgono kwane o dutse mane yena wa tlwelwa akere so tshwantse re be fair hore na o mang kaofela bakudi ba tshwana ba kena sepetlele le clinicing mme ditokelo tsa rona kaofela di a lekana. And then to strive for honesty and thoroughness. Tshwantse ka nako tsohle re sebetse ka bo tshepehi re sebetse ka bo lokolohi ka nako ngwe ke a tseba hore ha le ya dipetlelo so utlwe ho thwe ntsha 20 ranta mona o tla feta akere ha ya dumellwa ntwe o rontshe 20 ranta hore o fete lo ba ka pela batho ba ha ha se honesty eno ha se ntwe e lokile tshwantse re dumelle rona re le baahi hore e etsahale. And then to avoid unnecessary litigation dikoso tsa mmuso di kosa Department of Health tjhelete e ngata and hantse di re kosa tjhelete ya hore re le fe meriana re hire manese re go nna ke sepetlele le ditliniki e a fela ka hobane jwale batho ba claim against dipetlele le di eng ba sa bone hore ka mona ba ntse ba ithunya mona lotong ka re yona tjhelete eo ho sane tshwantse batle bana ba bona boragadi le bo malome ba tlo fumana tshebeletso. So ka complaints mechanism re leka ho covera tse hore re utlwane sepetlele batho ba tsebe hore ke sepetlele sa setjhaba le batho le ditliniki ba understand hore ha o etsa ntho empe mo clinicing o etsetsa wena actually le bana ba hao. Ya o qetela is to build staff morale kore mona re acknowledge hore ka nako engwe ha o ile sepetlele o itlhele hore motho a o sebetsang e hlile moralo wa hae o tlase mme ha motho a hlekefeseile moyeng yena self a kgone ho fetisetsa ho wena tshebetso e ntle so ke engwe ya dintho di-objectives tsa rona hore staff sa rona se tle se sebetse hantle se thabile ke le utlwile o bule ka serve with a smile hore se thabe le lona ha le tla le tswa hae le siye mathata a hae ka ntle ka hobane batho ntho e re etsang re etsa eng ka hobane mora o hlekefeditse ha o so tla sepetlele o so tla ka ona moya o be re hlekefetsa manese a ba re hlekefetsa le rona be re hlekefetsa manese jwale bona e ya jwang la e bona re le ke hore re itshwara re le di-citizen re itshwara hantle. Next slide please. Yeah, and then mona re bolela hore ho di-family kaofela batho ba tsamayang le bakudi le na le right ya ho ba acknowledge le na le right ya ho fumana apology kore apology kore a ke re ba bona jwa Sesotho ke tse class bua ka nako ngwe se a bale hore phephi a ke re ha o yentswe hampe ke right ya hao ho rufumane phephi and then tshwantsho re etse hore ntho tsena re di poto re di ska tsaetsala hape ho ba bang a ke re o bona ntho empe o shebela kwana e tlo etsala ho motho o mong hape kante ha o itlisa o complain o ngola kapa o tla officing ya CEO re tla beya metjha ya hore ska hlola e etsahale. And then engwe ko to ask for compensation or special consideration ha se re o yentse hampe o ka nna wa kopa re jwale ka hore nna se ke tshebetso ya ka e le tjena na ne ke kopa hore mohlomong he ke fuwe sena le sena le sena mo sepetlele ha ke tlile a ke re wa bona so es le so na le right eno ya hore ke batla consideration e itseng le e itseng. And then to seek the retribution o tlameile a re o yentse hampe o na le hona le tokelo ya hore mona nna ne ke bona hore nka compensate ka tsela e itseng fela ke negotiation a ke re tshwantse re negotiate hore na re tla ya jwang pele ha ile mona ka nako ngwe phoso di a etsahala sepetlele re tle re hopole re sebetsa ka batho ba bangata le di-clinicing le maphelo a batho empa ka hobane ho thwe ka sekgowa to err is human ha o so re ka nako tsohle di-doctor le manese ba ikemiseditse ho etsa batho hampe empa ka nako ngwe phoso di etsahale mme re tle re atla re a dula re bona hore na re tla isa jwang pele taba eno ya o qetela to give recognition to staff that provided le batho basebetsi ba rona tshwantse re ne re ba fe recognition jwalo. Next slide please. Okay, now mona ke tlo le ruta hore ha le sepetlele sa ka ebile ne ke a hopola my apology chair ka le bolella hore na ke mang ke nna Makibiti Madolo ke nna Chief Executive Officer wa Sebokeng Hospital jwale ha le ile moo le na le ditletlebo mona ke tlo le ruta hore na tshwantse le etse eng hore di tle di fihle ho nna re di solve e seng ke di utlwe se di tswa moyeng ke sa tseba kante ke ntwe ke be re dutse fatshe ra e sebetsa and most of the time le di ile moyeng ha di khutla o fumana hore ke ntwe ke be re solvile ka haro sepetlele so mona ntho tse re di shebang haholo ke di walk in National Department of Health complaints ke tlo explainer Premier's hotline presidential hotline bo human rights jwalo ke di institution tse teng ha le bona hore le kupile complain ha ya solveya ka ofela di institution tsa ntse hlamane ke mo le ka escalator ka pala isa hodimo tletlebo ya lona ha le sa khotsofala a ke ka nako ngwe re ka dula ebe ke a le explainela mara le fumane hore mona jwale wa re shaya a ke le na le right ya ho isa mo di body sintseng ka ofela National Department e na le complaints mechanism ya yona Premier's hotline la itseba batho beso ha le tsebe tshiluna e ka ga hae mona le jwanna le phaphame le tle le tsebe Premier's hotline e teng dinomoro tsa teng ke tseno le president o na le hotline ya hae a ke batho ba tsebang ke fumana complaint se tswa kwana ho moakamedi wa naha so le ditsebise dintho tsena kaofela ke responsibility ya lona hore le tsebe hore na metjha e teng ke eng hore le khone ho thuseha le health standard teng human rights etc kaofela ke tseno la e bona email le thuse bonkgono patientcomplaint.health@gauteng.gov.za ke ya rona departmenteng ya rona patientscomplaint.health@gauteng.gov.za ke mo le lodge and complain tsa lona Ho bohlokwa haholo hore le complain ba haesho. It's very important ka hore re batla ho phamisa maemo a rona. So tshwanetse re tsebe expectations tsa lona ke eng. Re tsebe hore na re le entse hampe ho kae. So that re tle re kgone ho ya pele re lokise dintho maemo a quality a ye hodimo dipetleleng tsa rona. Next slide please. Do I still have time? 5 minutes. Okay. Oh, okay. Yeah, thank you very much. Jwale mona he ke sketch fela se re bontsha hore na complain kala kae. Wa bona ha o qala like ke tsholo kala hona public institution mo. Ha o le Sebokeng kala Sebokeng. O ya ho matron, o sa yo matron o fihlele office nya CEO. O lo complain, ha ona le complain. Hore re o thuse hona hae. O ska tswela ka ntle. Ha e tlo re thusa ka letho e senya le nako e bilane. Ya bobedi ha eba ha wa khotsofala hona le district kapa province. Kore ke le bolela mechanism wa rona ka hara lefapha. Ha o tloa Sebokeng ha wa khotsofala CEO, ha o khotsofatsa kapa batho bana ba mo emetsa ba o khotsofatsa. O na le right ya o isa ho district chief director. Akere district e ore Sebokeng kwa le ha ba nketsa hantle. Kapa clinic ya le va emba thehlile tshebetso ha e hantle. Ha e bontso sa khotsofala o isa province. Hona le province se ke boletse mana akere o isa province le teng o ntso o complain jwalo o isa pele. Ha re tloa mo ke stage 2 seo. Stage 3 o ka isa o public protector ra mo tseba public protector. A ke tlo bua ka dintho tse le sa di utlwisise. Le a mo tseba. Okay, le tsamaya le lo sheba. Hore public protector ke mang ka bana ke motho a tla re thusang ho resolve di complaints tsa rona mo dipetlele kapa di clinic tsa rona kapa le ombudsman for health. A ke re hlola le utlwa ho to ombudsman. Le lo check. Di leaders tse teng mo tsa community, ma councilor nkang information ena kaofela. Hore a le tshwere di meeting tsa lona mane di community le rute setjhaba hore na ho tshwantsho ho complainwe jwang so that re tsebe ho lokisa ditshebeletso tsa rona. So o ka ya provinceng, o ka ya districting, o ka ya ombudsmaning, o ka ya ho public protector, even human rights commission e tlola re utlwa ka yona ke TV. O na le hona ho ya le human rights commission o lo complain ore ke likile ka ya ho CEO Madolo ha nthusa ka letho ka ya provinceng ka ya kae tletlebo ya ka e ntse e dutse fela e le jwalo. Next slide please. Okay. Yes, Papa, it's important. Thank you very much. Okay. Okay, jwale mona he ke tlo
Mama, we want to encourage because I see go back to the previous slide.
Yes, yes.
Yeah, you see where it says stage 3.
Yes.
This committee must be stage 3. People rush to the public protector who when there's a committee. This committee must work for you. The legislature must work for you. Even before you run to the public protector, you must test us. That's why we're here.
Se lo tlile ba yeso akere. Ho to committee ena e mona. Ke yona e tlo shebang ditletlebo pele re ya public protector le bo human rights le kae. Akere re ba kgethile ke di leaders tsa rona. Di leaders se tshwantsho di sebeletse. That's why ke re ma councilor ha sebetse. A rute batho hore na ha bana le ditletlebo ba etse jwang bona self ha ba sa tsebe hore na tshwantsho ba ye kae lona le tla tseba jwang. Ha ona re tla tseba. Mara I think ke ntwe tla nkuwa he ke leadership ya rona mona ho le ruta ka dintho tsena he. Mara committee ntate o sa tsholo modula stulo wa committee hore tswetswe pele le ya kwana le kwana. Committee ena ya portfolio committee on health e teng ke yane ho ngotswe ntho tsa yona la e bona www.gpl.gov portfolio committee on health ke ona ntho e entsweng ka hodimodimo ho rona hore e khone ho nka ditletlebo tsa lona. Akere matla a ho lona magale le lona vale mo ndi a makatsa. Okay, thank you. Next slide please. Ke bua le lona ka bana ke motho a mona le nna ke a le tseba go le etsa eng. So re tlile re tlo le route. Okay, ha re nka di steps he tsa complaining, these are the expectations. Within 5 days how complain ile o tshwantsho e acknowledge-we kore ba re he re fumane lengolo la hao ntse re e sebetsa akere matsatsing a mahlano ka moba hore o complaine and then within 5 days o tshwantsho investigate akere ha o complainile hore tjena nese la mbetsa ka tlapa o tshwantsho lo investigate akere hobane motho o mong le o mong na le right akere wena o tla complaina o re tjena nese le yena o tla a bua tjena akere so o tshwantsho bane le investigation mare o tshwantsho e be within 5 days so se re na le 10 days and then o tshwantsho o etse report within 15 days report o tshwantsho e be se e le teng ya investigation e etsahetseng and then within 25 days tshwantsho be re resolve ku dula le wena re o hlalosetsa re utlwa hore na ra utlwana kapa ha re utlwane na mara ke se ke le boleletse re sa utlwane ho na ho etsalang le a districting le a provincing jwale ntate o sa re hlaloseditse le ya ho portfolio committee on health a ke re utlwane batho ba eso le lo jwetsa le ba bang ha le tloa mona la utlwa lo ba hlalosetsa hore na ho tshwantsho ho etsa le jwang jwale if still not resolved seek expert opinion if ntse re sa dumellane le ka mora moo then ko hona he o ka yang tsane tse ka ntle bo human rights commission le tse ding kaofela akere okay thank you next slide please and then mona re bolela fela hore e solved the complaint haeba only satisfied ra utlwisisa ba gaetsho complaint e resolved kapa e qetuwe e ya kwalwa haeba wena jaka moahi o kgotsofetse o tshwantsho o kgotsofale ene nna ke le CEO ha ke na ona matla a hore ke kenye kgotsofalo ka mona akere o tshwantsho o kgotsofale ke hona re tla reng re kwetse kaofela jwale re a ikwala akere and then re ntse le redress re dutse le wena ga o hlalosetsa tsohle tshwantsho re kopaneng le di family kapa ba o supportang ro hlalosetse ntho kaofela and then kana kongwe he batho ba bang ba tla nka ditsela tse ding mare tseo di tla lata haholo ha ke no kena ho tsona and then the family always involve families it is very nice ha hona le tletlebo o bo nka malumenyana mane kapa o nke mogotsi wa o ska tla o le monto ka hore mama jolo tla o jaka mentality akere o tle le motho a tlo o mamedisa complain na ya hao akere ra utlwana batho ba eso ha re ska sheba metsi haholo a tla ho everybody re bua ka taba tsa bohlokwa mona tse ama maphelo a lona on daily basis next slide please go bona la ka reng ke qetile jwale wa bona ke be sa le la mmamela la tloela metsi jwale ke fitlile qetellong ya presentation ya ka ke a leboha haholo ha le mmametse mme ke kgolwa hore le utlwisisitse le tlanka maele mona a ntho tsohle tse ke di boletseng mme le kgone ho di etsisa re sebedise di local leaders tsa rona hore ba re emele ba kgethuwe ke rona re le setjhaba ha re ba sebediseng hore di complain tsa rona di tle di solve and remember how complainer o thusa nna jaka mookamedi hore ke lokise maemo aka akere ka hore ha ke hohle matlo aka ha hohle sepetlele mare wena o kwana ward 23 wa bona ha o complainer ke a bona hore so ho bolela hore hona le problem mona e re ke lo sheba hore na o hetsahalang ha kalo he ke qetile nna mogadi ya majake ke a leboha
No, thank you very much. Agere lo utlwile mama le bomme le ba utlwile agere ya hore ditshebeletso tsa lenaneo la lefapha la tsa maphelo di tsamayang hore ha nna le ditletlebo le ya ko kae ene ke ditletlebo tse di fentse le hore le kgono di kenya agere re batla hore le berekise tsamaiso mama o buile nnete hore nako e nngwe re na le o kra bangwe ba lona le postile go bo di social media e le hore ala re leka re le committee re na le committee ke committee ya lona ya kere ke batlo itsise maloko a committee ya ba ikitsisi re na le mama Evans mola ke re la mona kere.
Good day, everyone. I am Member Evans and I'm part of this committee. Thank you.
Renale Mama Hicklin, agerla mon. Mama Madeleine Hicklin.
Good morning, everybody. Igamalang Madeleine Hicklin, and I love being part of the Health Committee. Thank you so much for giving us your time today. Kia leboga.
Hona le mmele na o teng ba re ke mme Mamokgwana Semaro ka ro tswetse go ntla kere. Re na le maloko a farologaneng a tswang go mekgatlhong ya di-political party tse di farologaneng. Akere. So you are fully represented in this committee. Ha ona le bothata wa re founela re modula stool. Ke itemoela mathata ka mara kliniki ye. Even before ka mathela go kae. Akere. Ha re palletswe ke ona mo ka reng ai ba palletswe batho ba le e re ke go ho. Akere. So lenale you are spoiled for choice or le kaya go kae. Mara ba tlo re le ke committee ke committee ya lona pele. Ke ona ena le tsebo ya hore manane wa lefapha tsamayang. Akere la utlwa ba golo. But mona go nya ona nong I just want to check with members whether there might be any expressions on the two presentations before we open up a session to the community. Is there maybe anything that you might want to say?
I'm good, Chair. Thank you so much. We'll discuss in our committee meeting when we meet again.
Okay. Member Hicklin, is there any expressions maybe on the two presentations before we open up to the community?
No, thank you, Chair. I just want to encourage everybody to make use of us, to come to us with your complaints so that we can escalate and do whatever we can, because health is a basic human right and everybody needs to exercise that right. Thank you, Chair.
Nora lewa. So la ke re la ba utlwa maloko a committee ba dumelana le ona kgannye hore a le na le matsapa le kang committee. Akere committee ke committee lona ke lona le tsentshitse mo a le reletse gore a re leletse favor o thusaneng le lona. Akere ke lona le ileng go ditlhopong la rena gore ke nya batho ba so tshwantse re kgone le berekela. Akere so mo nakong ya ona nong re tlo tsa matso mo lona ba le gore motlhomong o na le se o le gore nga wa se tlhaloganya motlhomong o na le se le gore go batlo se bontsha a re tse di complain mo. Akere mara wa just saying these are the issues ke batlo di deposit MEC wa rona o teng. She's also going to assist the team to respond to those issues. Akere and then our emela wa ikitsise gore nna ke nna mang ke tswa ko kae, and then you become specific, how generalize. Our the healthcare system is problematic. You don't do that. Again, you say to us, I've experienced a problem here, I've experienced a problem here. These are the names of people which I interacted with. They did not assist me. This is the clinic, this is the hospital. I've got a relative who I took to this clinic. Like Rena specific. Refana ka di details as much as possible so that you can have a direct responses. Agir lu utlwile. So ke tlo simolla ka mo writing ya ka. Re tsa matso agir ba golo. And o mong lo mong wa lona wa tlo bua. A ka nna bua in any language. Agir na le batho ba translator. Sko tshaba re nna ke tshaba bua ka Sekgowa. Therefore re ke ska express. Re batla gore o mong lo mong wa lona a di express in any language that they are comfortable with. Agere. So are bone matso a ba batlong go bua. Re tlo le fa di number agere. O nna number 1 mama. Sister Mabela o wibele. O nna number 1. Ntate molo o nna number 2. Mme mole ka Katiba molo o nna number 3. And then mme ka ntwe green o nna number 4. And then go mora wa ke bona re ke mme re ke ntate ka re ke mme agere o lo nna number 5 agere ntate ke yo mo o nna number 6 so re na le matso a 6 ka ba golo a ro boela go morao agere a ro nna le second round re batla gore o mong le o mong wa lona o batla go bua a bue ona bjanong akere so re na le matsogo a mai 6 ka mo 6 hands akere go sampane o na le matsogo a mang going once o mme o batla go nna number 7 going twice it's gone akere a ke batla gore o mong le o mong a tle mo a complain ore modula stulo re gateletse a re fa monyetla wa re bua akere 7 hands and then re tla ka mo left yaka re tsa matsogo o let it go ro skwa nna le floor crossing o mong a re a na le ka mo ha ona floor crossing so mama o lo nna number 1 ya rona ka mo left akere ntate molo o nna number 2 ntate mole number 3 ka mo next door ya hao number 4 re na le matsogo a 4 a ke re tletse lona mo re le ipue a ke re batla re le ipue mo pele mokhuduthamaga wa rona wa lefapha a re batla re le mise monyetla so re na le 4 hands ka mo left le feleletse ai wa itse gore ke koparo ba sammane ba dule mo fatshe ka re ba tla emella sebaka ke ba bang ke bagolo skwa emelisa bagolo sebaka a ke re ke matsogo a mafo ba ikitsa ke re a re batle bonwenwe a re batle ba ile gore ga ba emisa matsogo e be ba itshukunyetsa so ke 4 hands fela ra ikwala mama wa tlo nna number 5 mama yo nna number 5 going once going twice ile akere re na le 7 ka mo re na le 5 ka mo akere bagolo ke batlo rata gore nka lefa the whole day re le bua mara go kgonala akere so re batla fela le nopole be direct be specific mara le ska le bala gore le simolla ka mabitso a re start ka number 1
sanibona igama lami nguNomasonto ngihlala ePulukong ngina ukuthi ku MEC inkinga umzala wami
ya a re thuse ka mike a o sharp akere
umzala bamdishaje 2 weeks back Sebokeng base bamnikeza
a re thuse ka mike o ka ro betero maybe it's out
wait.
Sanibonani, igama lami nguNomasonto Sibanyoni, Ward 25 ngibuya ePulukong. Nginenkinga umzala wami uSaykhiki bekase Sebokeng esibhedlela. Bamdischarge 2 weeks back. So makaphuma esibhedlela basinikeze incwadi ukuthi aye eclinic. Izolo uyile wayelanda medication eclinic ePulukong. Mayefika ePulukong bathi i-medication yakhe ayikho aye eliva imbatha. Wavukela namhlanje waya eliva imbatha. Makafika eliva imbatha bathi hayi cha i-medication le ayikho aye zone 17. So manje ngifuna ukwazi ukuthi kahle uma ba discharge umuntu abakutsheli kahle ukuthi le medication uzoyithola kuphi ngoba abamisa lena le ene lo muntu akaphilanga.
Nna ke Pule Mokoena ke tswa Ward 25 ke Ward Committee member mdula stulo kore wa tseba nna kore ke a leboela nthwena le committee ya hao mo hona le ntwe e nkutsang bohloko haholoholo ya hore se ke le moholo ke le mokana kore ha ka o sheba clinic e yona ya zone 14 seka ha mkhanselara ana ibua mo ke holetse mo ke la ba ka tloa ka o dula Ward 25 intse le yona purchase e kenang batho ba 5 ka hare ha dipula dina tsona Maria kore e re utlwisa bohloko so ke ka ho ke reng re thuse re community ya rona maketšhene kana antsa eketsea le bana setšhaba se a eketsea mara ka clinic e nyenyana e ya purchase ke le buile
Dumelang, dumelang. Ke nna Mathabo Letheya, Ward Committee from Bophelong. Ward 6, from Ward 6. Batswadi, khale re complainela selemo se bile se fela, and the community bona ba khutlela ho rona ba re botsa hore ha re khutlele ho bona ka di right answers tsa bona tsa di complaint tsa tse rona re di tsamaela mhlena ha re tla mona ho lona. So rona mhlena ha re batlela di meeting ha re tle ka di right answers tse ba di lebeletseng ho rona. Even rona kgweding ene re tshaba lo ya re lo ba checka because our mobile clinic ha ena evenly a shade. Dinyane di room tse mo di sisters dia complainer na re tshaba lo checka go sister o dutse jwang le bona ka mo ka ga di room. So number 2, and our Bophelong clinic a kere ga tseba enyenyana batswadi. Re re tshepiso go tla ba le clinic but a re tsebe ho fihlela neneng. Mara mohlomong for now re tlo ba ska Johannes e tlo renovate. Ho tla ba le at least e tla re thusa after so renovate we ha banning e tla extendwa le yona. Then engwe ne ke batla ho ikopa batswadi ke ya gona le hape the unfinished homes tsa maqheku ha di qetwe le tsona, and then hona le di sisters tse ithopang hore di batla ho tswela pele le maqheku. So ha re ha masepala ona motho a re thusang hore di buildings tse tsa maqheku di tlo qetella di qetuwe neneng. And then number 3, rena le engwe ya di hona le ha ra tla le bona ba disability ba kopile hore le bona honya ba nya le bothata hore ba ho to ba rente. They must rent for their, if ba batla space for their disabilities. So ba ne ba kopa hore ba thusetswe le bona ka taba eo ya hore o tlamehile ba rente in our government buildings na. Ya o qetela batswadi ene sa re dula hantle ska selemo se se fedile tjenana ne re kopile re nya le complain e ile ya re utlwisa bohloko ka kgwedi ya ya Phelo Pepper health train ene ya staff post ene tlile mo ile tlisa mo ferefere rona ka rabo Sebokeng ka mona because batho ba bangata ne re ba applyile from ka Val mara ha ba ka ba thola mesebetsi ka mo mara train e tlile e nya le staff sa bona o tswa outside Joburg. Le eo ne re kopile hore le re lokisetse batswadi bana ba kopile ba itse ba tla khutla hape after 2 years. Hona le maqheku ana ba bang ba sa khona le ho thola di braille hobane ba bang ba qeteletse ba khutla di lining. Because batswadi ba bangata maqheku haholo ne re rometse maqheku a mangata na ya mo a lo kopa di braille ba bang ba qeteletse ba khutlile ba ngadile mo bana ho no ho batluwa ditjotjo for ho patala ho reka di braille tseo empa re ne re thotse message hore ba tlo di thola mahala. Ke a leboha batswadi.
Dumelang kaofela. Lebitso la ka ke nna Thuli kapo Irene Honoko. Ke moahi wa mona Sebokeng from Ward 37. First of all, ke kopa ho welcome baeti ba rona for today as member of the community. Haholo jwang ka ntho ena ya health because before any other thing health come first. And then ke appreciate le taba ya hore le engage le runa because communication ke yona the initial thing before any other thing. And communication ke yona e leng hore e re failisa kapa e failisa government ya rona hore ditshebeletso tsa rona di tswelle pele hantle. Ke bua tjena because communication is my area of speciality. And before you can encounter matata a itseng, you think you know until o kopana le wona directly to you, which happened to be the case with me. So it happened that ke be diagnosed with DVT, which is deep vein thrombolysis. I have clot on my left hand side. on my left foot side. And ke be ke ba patient ya kopano. A mararo a serious mathata ao ke kopane le ona, e leng hore I would like to put them forward. Lintle le tsena tse ding tse ngata-ngata. But all of them ha ke di sheba di basitse hodima communication. One, ho qaleng haka ho fihle haka Kopanong Hospital, my first visit. In fact, leoto la ka le ne le ruruha, my left foot it ne ruruha, ke ile shopping on the other side, which is Checkers. I then decided hore ke kene ka mo ka Kopanong, ke ba bolelle hore ha ke sa kgona, I can't even drive. Ke ile ka tebelwa. Ke ntho ya pele e etsahetseng. Ke tebetswe ke tlaraka etlek ya mane registrationing and mpolella hore I should have first started at the clinic e ke leng ko yona, ke re no. Leoto le ruruhile, but le ba worse ha ke se ke ithola ke le next to Kopanong. Ana molao wa e dumela ntho eo. A re ke re tswa o tsamaya. On my way out, colleague ya hae e kgonne ho elellwa hore I could barely walk. She decided to get back to me, abe ampulela file. To my surprise, ha ke fitla ko casualty, I was told, hore, you have to be admitted. Otherwise, this thing ha ya hodimo, you are gone. Bophelo bo ile. Ka makala hore ya neng a ntebela yena o na re ke shwelle tseleng na. It happened, I got admitted. Ke le warding, ho na le nako be leng ba nkenya on the second day, ba nkenya drip. I complained to the sisters hore wa tseba ke drip e leng kentseng yona ha e ntshware hantle. Ba re ho nna o tlamehile o imamelle drip e bohloko, ke re ha ke bue ka bohloko ba drip, ke utlwa the type of medication e kenang in my system ho hang ha e tsamaelane le nna. Ba ga imamelle. In no time, ke bana le seizures. First time in my life. And I can tell you, how bana o experience the seizures, you can still see what is happening in your environment, but ha una control it to yourself. Ke mo kileng ka bona bo sister ba ba raro, 3 sisters. O mo nga tshire pakete kgolo ya mazimba ma nicknets, ba tsheha ba re maybe I was assisted by a fellow patient. She was 18. Right. And not forgetting the fact that whatever because experience but we were forced to be in there. Because I complained to the doctor. The doctor decided to discharge me. Because you're waiting for the screening, get a appointment ko Sebokeng. And thereafter, o attend the treatment because seemingly your relationship with the nurses in here, going forward, and it will be subject to further abuse. And I found myself a patient ya clinic ya Kopanong. Right. Refite bono. Bo emo ba boraro bo ke kopanang le bona be ban challenge. Ke bona. Bo serious even. Ha ke nka, as you would know, ke sebedisa the blood thinners. Ke nka your warfarin. Ho fitlile mo ke leng ka ithola ke se ke bleeder ke le hae. Ke bleeder ka all masuba kaofela aka. Ho tswa madi a mangata. And then I went to the hospital. Ho fitleng haka hospital. Hona tsatsile one, ke a bleeder severely, so everyone could see that. Even little patient tse dutsing di eme mono since letsatsi in the afternoon. Oh, nobody was attending to take the vitals. Nobody. I had to run around to find somebody to assist that side. Kinte ki bleeder na self. I pushed my way into the casualty. I demanded to be given attention, and I also asked for vitamin K. And I was told by the doctor, when I was clever, when I was vitamin K. Well, the last thing I recalled after that, thereafter, I'm not feeling well, we are bathroom. As to what happened thereafter, I don't know. When I woke up, ke se ke le ka into some other room, e ke sa itsebeng, e senang batho, ke palame hodima tafole ena ya teng e shine-ang, ke ntse ke na le piece yane ya what do you call a drip e bana ba nkentse yona ya vitamin K, and then ke dizzy, I don't know what is happening in there. Ka moha wa Ntate Modimo ke kgonne ho theoha mono ke mong, remember, ka bula monyako ke bosiu. I walked around kopanong ha ke tsebe le hore ke ya kae. Mohlangwane khona ke bonang hore I'm in the hospital, and then instead of taking that route direction ya casualty, I decided to nka the exit door. After exit door ka bona koloi ya ka le mohatsaka was there. I went in, a go honna nna ko tseba o admituwe, so ba tlo checkela the ward e ba o admitileng ho yona, and I'm like, ha ke admituwe jwang ke le ka hara room ke le one ho sena anyone attending to me. Kabaliya, I don't want to lie, ke ne ke tshohile because clearly ke ne ke le stopo ho ya ka mokgwa maemo ne ke a shebile ka teng. Little did I know 2 weeks down the line ka date ya ka ya appointment, ha ke fitla mo ke ya mane ke lo batana le file ya ka, because you have to fetch your file before ba ka lonka di samples tsa madi ka mane. My file was nowhere to be found. I waited 2 hours. After 2 hours, I decided ho ya ho bane
Mama Erin, wa itse story se botlhokwa thata, mara ke batla re just to manage time, because ke tsaba rona le batho ba bangwe, and obviously department lona tshwantse fane ka dikarabo. So nenka thabela if we can just summarize it. Ake batlo stop because
okay. All right.
nze ke discussa le MEC.
Yes.
And she has even shown me the videos.
Yes.
Or mona kong e fetileng no buile le ena on these issues.
Yes.
And she has explained that there's a process that they are following, because your issue was already registered
Okay.
with the office. So they are still working on a process to investigate what actually transpired.
Okay.
So Negeri, maybe just in summary, so that we can also allow
Okay.
other people. But it's a crucial story. Yeah.
Okay, let me summarize. At the qetellong ya case ya ka kore, even on their files, I was declared dead. I made follow-ups with their quality manager, facilities, whoever. She had 2 meetings with me. Tse leng hore o ntsa dismiss o hana le ka di minutes tsa case eno. But luckily I have the recording, start a second meeting as to what transpired. The worst one, now that I'm still continuing with my treated dead kopano, ke se ke le motho ona na a treatwang ka tsela ya hore kwane. It is to the point ya hore everyone who is here can be told kapo a tsebe ditukelo tsa hae, but ke batho ba baholo bana ba tshabang hore hae a visitela mane ho bontso thu ke mangwane a batlang special treatment, a batlang special attention. And it's true, MEC, we tshwere case ya ka, although MEC ke se happy hanyane because ha ke so thole karabo e nkgotsofatsang. Ke a leboha.
Raleboa Mama Irene. So at least the committee will be able to follow up with the office of the MEC, or how far are we in respect of the process that they agreed to follow in probing your issue and ensuring that ultimately you find the relevant redress for the experience that you had to ensure. Let's take baholo kirile ake batlo le limita ka nako akere mare because hona le batho ba ba mailo re le bona ne ba misitse matso re tshwantse re manage nako a rona akere. So ke batla re dumellane, is 3 minutes enough? 3 minutes ne ntate wa kilo tla re thusa to manage the 3 minutes akere. And then if there are any other issues that you might want to raise, akere re teng re le committee re tshabe. We are going to leave our details, le rona le clarify the business card tsa rona, and then go ntle ona le ba di petitions ba na le ditafola go akere or le khono tsenya tse ding ditletlebo go teng. A re tswelle my sister.
Good day, everyone. Libitso la ka ke Mamiki Ngube, ke tswa ke le from Hammanskraal. My complaint, I'm just gonna summarize. My complaint is based on Jubilee District Hospital. It's a disaster. Okay? I'm just gonna summarize the past 2 years. Ke na le motlogolo o na le asthma and she's 4 years old. And this Jubilee District Hospital. So every time she has an asthma episode, she gets admitted. Heriaromo visitor, it's either wajikisiwa or when you go there, it's a disaster. Ngwana dripi itswile, she's bleeding, ho butisa, wa futlediwa, ho umanyiwa, you end up in a fight. Again. So because of ngwana wa lwala, you tend to calm yourself down or attend to ngwana again. So recently this year, I had a premature baby ka February, ka di 17. It was a disaster. Kamu wotong kamola, remember people have given birth, women are bleeding, babang kidi miscarriage, babang, after miscarriage, some people lose their mind. Again, bamia the same word loen. You can imagine the disaster that woman is going through. And then when you're here, how yena she just lost her baby. When she's losing her mind, your baby is here. Your baby is here. Mutula is having a mental breakdown. That is my story. I gave birth to a baby girl. She was 2.2 kg. And then there was a lady who lost a baby. And then she was having a mental breakdown. It's a bed, and then ki koto ya ngwana ki bed, ki koto ya ngwana ki bed, ki koto ya ngwana was next to the window. That lady urubetse mo koto ene tshwantseng hore ho be le ngwana hae, it's empty. And then urubetse kamo, she had a mental breakdown. Ku utlwile fela he setse nabile, I think ke back ya di toilet ro re eng e wela mo dima ngwana when she was screaming and throwing things, a screamer, are kenyaka ngwanaka, kenyaka ngwanaka. So it was a disaster. And maybe the department or Luna committee leading some sort of sensitivity, sensitivity towards women after giving birth. Those who have maybe lost their children or having something, a special room. I get serve with a smile. And then more serve with a smile, there was a slot where they said sensitivity. Again, so nekopela hore ibe visible liko jubi. After giving birth, we bleed, depended the hour and everything. Okere ele madi everywhere. Okay. Okere ele madi everywhere and you have to step there. Remember, we don't know huru utla ole kai your HIV status dilo tse biao. The water is leaking. Madi ala rotileng. You don't know huru arotile from manko kai afita. So or you have to step hona mo otlap. Unfortunately, my time is over, but nekopela hore leba kore le kar le ka ba tlotloetsa hore ba itlhotlhaetse le ka taba ya cleanliness. I didn't expect it after having COVID. Thank you.
Dumelang, nna ka lebitso ke Princess Ngonyane, ke tswa Ward 25. Ward 25 e vast, which is Renali di Ploto, whereby di Ploto tsa rona, hona le challenge ya mobile. E leng hore sometimes o nka kgwedi o sa tle. To a point ya hore re kile ra ya ka moo, hona le nkgono a llang ka taba hore o nka medication. And ha nka medication kgwedi ha e feta di ntho e sa tla, o bana le bothata. So it have to I go Johnny's. So but last time ne ba buile nkare Johnny's e tlo assist, but nkare problem e ntse tswela pele. Ya bithu ke tlo la ka Sebokeng. Ke tlo la ka Sebokeng. I'm fine. Ke sharp. Ke tlo la ka Sebokeng hospital. There is a point in time mo ke stemme mo ka sepetlele. Re fitlile Sebokeng ka 8:30. Mwaka ona le attended ka 4:30. So eish. Okay. To a point whereby now I have to see the doctor. Can I stress? tlamehile ke thuse doctor ka mme wa ka. So ilang di-step haholo hore Sebokeng se le sekanakana how ho tla jwang ho se ka bana le bo di-sister tse thusang. For nna Sebokeng it's a disaster. Sebokeng se hloka like attendance e serious. Se hloka hore se ede basebetsi because e ke se re ke tlile ka mokudi nna be ke tlamehile ke thuse doctor ka hore o mpotsa ntho ke sa itsebeng, give me what a ke tsebe ntho eo ke tlisitse motho wa kula ke re what are that one le nna self ke tarakane hlooho. So ke kopa Sebokeng ke a kopa haholo nka re ba ka add staff. Thank you.
Molweni mnandi nguThami Mkhiwane ohlala apha eWard 31 and I'm the chairperson of the clinic committee zone 14 clinic. The only thing that I wanted the intervention from the portfolio committee, we've got the challenge in terms of the local clinics that belong to our municipality. So if the portfolio committee can absorb all the local clinics that belongs to a municipality and being professionalized, abese province, I think the issue yama clinic amancinci and then also the outcry of the patients in those small clinics can be resolved, and also the structure of those small clinics are also the challenge. It won't be corrected that always we'll be saying our clinics are small. At the end of the day, the challenge is not been resolved. Practical example, Zone 14 clinic, we lost 2 staff members. Even if Chair and the MEC, we can just make a dry run now and see the conditions of the councillors there. It's not favorable for them as a staff members. It's not also favorable for the community who are consulting in that situation. So that is why it is the challenge. We're still waiting for the park home that were promised to be brought to Zone 14 clinic. We are still waiting. That is my earnest appeal to the portfolio committee. If they can intervene and to make the intervention, then I think our clinics will be better. Thank you.
Ka lebitso ke Lulu, sefane ke Matlaletsa, ke tswa Bophelong, ke community ya Bophelong. Rona ka Bophelong, Ward 23, ke utlwile the chairperson ana re bue le makhansela ga rona. But rona ka Ward 23 e ka ga rena le councillor. Hobane le MEC ha ikaya hona jwale Bophelong, ka ga Bophelong. Elo fumana ha hona bophelo bo botle ka moo. Le ka ga clinic ya rona re na le mathata. Ka ga clinic ya rona ke tsebe MEC hore suggestion box ai fihla mohlomong ho lona ditletlebo tse ka hare ka moo mo di ntshitswe ka moo. Ha re tse hobane di complaint tsa rona tse sale tse re complaina ka tsona re le community hore ha re tshware hantle ka moo ka ga clinic. Ha re se utlwe re fumana karabo tsa te hore mohlomong ho tla ba le di tse tlang tse le hore di tla ba betere tse tsalang ka ga clinic. Engwe hape ke rata ho tseba nna last week ho la ba le emergency, so ke batla ho tseba hore clinicing ya rona ha ho kgonagale hore emergency e attendiwe na. Hobane ho la ba le emergency ya ngwana wa 5 years a hatuwe ke koloi. ha tlameha hore ambulance ha ya fihla ha tlameha re mo nke ngwana a ye John Hayes wa 5 years ha thi clinic mane ha hona thuso ra tlameha re ye John Hayes le ngwana ha re fihla John Hayes le teng ho thi ha hona thuso bakeng sa ngwana ha tlameha ho thi re ye Sebokeng hospital Sebokeng hospital le yona ya re romela kopano mo bophelo ba ngwana bole ba fella teng maobane re ne re pata ngwana ona ka bophelo so ke tlo re batla ho tseba hore ha o fihla clinic ba ho thi clinic re kale teng re fumana thuso teng empa thuso ke mona ha ka ba ra ithola jwale re kopa fela ho tseba taba ya emergency ha o fihla clinic ha e be teng nang le engwe hape ke a hore di sisters tsa rona ba teng ba bang ba sebetsang le community hantle ba bang ba teng ba sa sebetse le community hantle jwale le nako ke engwe e lo re ra ilwanela le re kopa hore nako di sisters tsa rona di ke di tshware nako hantle ya ho sebetsa hobane ka nako ya bona ya ho sebetsa ke nako ba nwang tee ka yona ba buang tsa weekend ntho tse kaofela all staff so ne re kopa hore ha le ka ba kena fela hore at least nako ba hona le maqheku a tswellang clinic ka lebaka la hore nne wa ba khutliswa ho the nako ya bona e fedile ya hore ba tlo sebetsa ba sebetsa batho ba kana ka letsatsi so engwe ke yona e re batla ho tseba hore ana ka letsatsi clinic ya ntse butswi till 7 o'clock ho tlamele ho be le palo e sebeletswang fela then batho ba kulang ba tsamaye ba khutle ba ntse ba le jwalo na ho tsona le ya dipilisi ha re fuwa dipilisi hona le hore ba re fe medication o seng right yona ntho e mama ana a ibua a re ba o fa ntho e le hore ha wa tlamela ho e sebedisa so ne re kopa hore batho di sisters tsa rona di tsebe mosebetsi wa bona ra kopa MC thank you
Sanibonani dumelang igama lami ndinguGugulethu wakwaChwane I'm from Bophilong Ward 23 khona la eValley so to the committee ne ikakhulukazi uMEC nobaba uLitswalo ngithanda ukuveza nje lamagama andizoba mde kakhulu kodwa MEC please nawe baba uLitswalo ne committee as a whole ne okokuqala ngithanda ukuqala kwi presentation esithole lana namhlanje ipresentation inhle kakhulu siyayibongela kodwa mina ndifila engathi ipresentation lena 14 kakhulu yabo 14 kakhulu ingezi isentsho ingangeni kakhulu ukuthi izameni yona ibalekile ukuthi nathi okay siyazi ukuthi ama right wethu as ama patients ehospital but ngicela ukuthi as a committee nawe mama wase hospital eSebokeng yenzeni ukuthi maye kuma sister manje kuma nurse ingene then nina niyenza ukuthi isebenze because abafowethu nabodadewethu bayafa bayaphela ezibhedlela nasemakliniki ngenxa ye sisters endingazi noba mhlambe phaya zenze ingathi kusemako kwabo or baya owner izibhedlela uyabona kubhlungu kakhulu thina nabanye sesiyasaba nokuthi siye emakliniki uyabona ngenxa ye treatment impatho mbi esifumanayo ezikliniki nasezibhedlela I'm sorry Sebokeng hospital angaka attendwa Sebokeng hospital kakhulu isibhedlela ndiyasoyika futhi enye uyabona but ngokuya ngabantu esenba ukuthi abantu esebebuya khona endibaziyo uyabona iexperience from kubantu iSebokeng hospital is very worse uyabona kakhulu into enikhala ngayo ixesha eSebokeng hospital umama phaya xa ethi uyakwazi ukufika ngo8 or ufike at this time maybe ngabo 11 uzo attend kusasa uyabona uzo attendwa kusasa Sebokeng hospital. So ndibuye MEC no mama MEC no Tatulizwalo ne, I won't blame istaff kakhulu esasesibhedlela uyabona, but andithi andisblame naso, but nani uyabona mhlawumbe kunento ekuthiwa yi overcrowding uyabona, mhlawumbe I overcrowding asiyazi, because why ndisitsho so, Sebokeng hospital I think it was built ngexesha le apartheid uyabona, le apartheid. So khona ngoku sekwakhiwe izinto ezingaphi after Sebokeng. So please zamani, then enye into MEC please, le ndaba le yama private hospitals nama public hospitals ne, I think health or whatever or government focus is on abantu abasebenzisa private hospitals because of imali, and xa uthi uyabheka abantu abasebenzisa public hospitals they are more than number yabo ingaphezulu kubantu abanemali uyabona. So please ake nizame mani indaba yesibhedlela ukuthi nathi thina singanamali iyasibetha kakhulu, iyas affect. So ngenxa yexesha ndzaba mfitshane, ndiyabulela.
Sanibonani Dumelane Absheni. Igama lami nguSoli Maseko from eThokoza Township, under the organization Disability Usike Wanyatsa support group for people living with disability. We are dealing with disability, different disabilities. Abangaboni, aba physical disabled, naba mentally intellectual. Kancane ngizama ukukhomenta into esho last speaker on the other side. Yokuthi ama-clinic ethu mancane and under umasipala, but ukhulumile lokho. But I did put a petition before even the COVID. The director of health he came in Akuzana towards the Dresser clinic. And then but was attend yes and director of health from Eguruleni. Into bayenza nje i1 bafaka itende but waiting area. But the staff still is short lapha in Akuzana ema clinic. Because I too penduka clinic where is saving informal settlement plus ama hostel. Up to now, they didn't come back. Good basitshela or basinezi report back. So far ngithi abanye abantu enibafelayo abantu abangaboni. Abantu abangaboni akuna privacy for bona. Abantu aba visual impatient. Because ngani umuntu ukuthi abe ne privacy because kunomunye umuntu ofuna kamfundele. Because akuna braille. For amapilisi akho ukuthi wathatha kanjani. Angeke asithathele ufuna kube nomunye umuntu wesi2 ozokhona ukuthi amtshele ukuthi lawa yini athathwa kanje. Akuna privacy for abantu abangaboni. Ngiyabonga.
Sanibonani madala. Lokhulumayo uTsokolo Khwaele. Kuzwa kuthokoza Thokoza care of the age. So akunataba tse ngata tse ke na le tsona taba ka mo le tafuleng fela mole. So tafuleng mo ne ke kopa next time I be mhlomong ke tla bitswa hape mo. Le re etse print out ya presentation e nna le yona ka jeno. Because why ke na le ngwana Stoutu mo le hae. Ha ke fitla tlo batla go tseba re ntate no ile kae ke amduetsa jalo ore ho no etsala mo ha ke sa khona mhlalosetsa because ka boholo ba ka ke a lebala bo. So jwale neng na lo re ke tle le tsona ba ke mne ke re taba ke tse mo dinteng a ba la utlwisisa a khotsofala bo. So ke re please next time le mpele re tsetse jwalo ke yona taba ne ke be a fela ho nna tafuleng mo. Thank you.
Kere nere badile 5 people ga. Ona le momo go morao kwa ga re se a tshaba bjanong a ke. O ile toilet. Mara ga se go no memela ke. mohlomong ko bofelelong ba lenaneo la rona re tla mo ala wa re a fane ka ntlhena ba tlo e ntsha kere mare for ona non re utlwile matshwenyo wa lona kaofela re tlo kopa lefapha le fane ka dikarabo mare ko ntlheng ke lo fa MEC and then MEC ke ena tla re supetsang gore ke bo mang ba tlo fanang ka dikarabo tseo MEC.
Chair, I'm going to ask Sonwabo to start, Chief Director, and then CEO, then COO follow, and then I'll be the last.
Thank you, MEC. I think my mic is a bit better. Dumela, Ligai. Thank you so much. My name is Sonwabo, and my surname is Lindani. I'm the current acting Chief Director for the district. Let I give my official greetings to the Portfolio Committee Chairperson, our MEC, the executive from head office, led by Dr. Slepe, our COO. We have as well the executive, I think, from Sebokeng and also from the district here. So, but moreover, MEC, I think I need to greet the community of Sebokeng. I think it will be an omission if I don't start responding, Chairperson, by asking us to give a round of applause for all the people that have attended this event. I think let's give a round of applause. I'll tell you why. I'll tell you why. Because look, there is nobody who's gonna care for our health except ourselves. This for me talks on the importance of health to us. And I'm from Levimbata, from one of our clinics here, and I think I was with the community as well there. I was saying to them, these clinics are owned by them, they belong to them. We have 3 hospitals in Citibank district that is led by our MEC, Mayor Alohoko. We have 38 clinics that are existing in this part of the province. We have 4 community health centers. These are the facilities that are operating for 24 hours. There is a reason why I'm so happy that there is this good turnout here, Chairperson. West towards the journey of implementation of what is called NHI. NHI is a vehicle that we are using as a country towards what is called universal health coverage. So we want people to find services closer to where they live. And we don't want finances, how you afford or not afford, to determine whether you'll get good quality health services. So this thing of a 2-tier system of the private sector and the public sector, it needs to go away, which is why our president has signed this bill of NHI into an act. So this is why, for me, it is very important that as community and as people, we are taking a priority to our health. So without wasting any time, MEC, I'll start with the first question that came out. I'm very happy though with all the questions that were raised here. That is why we are here, we're existing for all these things. There is nothing that is going to improve the health services or the care that we want to get in all these facilities except us. You shouldn't leave any facility if you are not happy. I normally make this example. If you are in ShopRite or in any of the shops, there is a problem with the teller, the one that is assisting you to buy there. You don't leave a shop. You normally ask for a supervisor. If you are not happy with the supervisor, there is normally a manager. If you are not happy, in this case, we have 3 CEOs in this district for Sebokeng Hospital, which is our biggest here. It's a regional. We have a CEO for Kopanong Hospital. We also have a CEO for Hidleybeck Hospital. I am the chief director. I'm in charge of the whole district. So in case anybody is not happy, then the last result is normally me. A lot of times, if you engage the CEO or the clinic manager within the clinic, you don't even need to talk to me. So the point is that let's not leave the facilities. If at any given time we are not happy, let's demand these services. We are existing for you. We are servants. There is nobody who has forced us to come to any of these facilities. We are there because we want to serve our people. We want to serve the 84% of the population that is not insured. So the first question was Mam Trina. In fact, I've already talked to her. It's about Umadala Mtrina. It was raised by Uno Masonto, so I'll be talking to her. So we've exchanged the numbers already because there is a direct service that is needed. There was a patient that was discharged from Levimbata, then in Zone 17. So definitely we'll be directly intervening on that because I have her numbers. She's also having my numbers. There is also the issue of overcrowding. Overcrowding, it is a challenge that is generic, which is why our MEC has been advocating for the health facilities to be increased, the numbers, which led to the pronunciation that a lot of hospitals will be built. And I think we all know from the news that this government is planning to build more hospitals. It is indeed a challenge. Remember, we're saving the 84% of the population. The facilities are not increasing, and I think we all know that even around Zone 17, there were no locations there. Now we have a lot of informal settlement. We are not complaining. We are here to serve, but we are having this government that is very clear in increasing these facilities. So basically, we are working on that. We are coming up with all these measures, such as I Serve with a Smile. We are normally marrying that, Mamgiti, the I Serve with a Smile, to what is called employee value proposition, because our theory is one. There is no way that an employee that is not happy is going to be able to give you a happy patient. So we're actually collaborating and mixing that, ensuring that the resources that are needed for the clinicians to render these quality services, they are in place. The space challenges are dealt with, Chairperson. The space challenges are dealt with. The chairs are there, the office chairs are there, the patients are able to sit. Zone 14, Zone 13, indeed, they are falling under municipality. We're working very closely with them. We're in the process of fast-tracking what is called provincialization, where all these municipality clinics will have to come under us as health. Last week I was in Midval. 2 weeks back we were in Emfuleni. We're about to have a meeting with Lisedi. The legal is also involved. So indeed, we're in the process that is very aggressive of ensuring that these facilities are moving from municipality to the province. There is a reason for that. The law of the country says the prerogative to render and provide services doesn't belong to the municipality. It belongs to the province, which is why that traditional element of municipality providing services is outdated. And these facilities, they need to move to us so that we are able to maintain them. The infrastructure is an issue. Yes, indeed, the Joan Haynes, through the intervention and the pressure from the MEC, and I think because of what happened sometime last year, we have an approval to convert Joan Haynes to what it was before 1994. Sebokeng Hospital is not coping. It's totally not coping because of the high numbers of patients that we are having. So indeed, you do have 15 minutes away from Sebokeng, you have Kopanong Hospital, but that's still not enough, which is why Joan Haynes will stop being a clinic. It is going to go back to being a hospital. So we're in the advanced stages of ensuring that that is in place. We work on something we call decanting plan, because we can't just close that clinic, because there are people from Vanderbilt and the surrounding areas that are getting services there. But it's a matter of time before we start and we operate there. We'll open a district hospital that is going to be around 220 beds. But it won't be a normal district hospital. We want a hybrid hospital there that will have at least a minimum of 6 to 7 specialists, so that you don't work as a conveyor belt that transfers patients to Sebokeng hospitals. So we want some of the patients to be contained and managed in Joan Haynes so that Sebokeng stop being flooded and being overcrowded. May I read from Ward 37? We don't normally talk more about their doctor-patient confidentiality issues, Dr. Mfugeng. So we don't want to talk about those, but yes, I think I took her name. May I read? There is Dr. Victor here, who's seated there next to the CEO of Hidleyberg Hospital, Dr. Mlatlegi. So we want to help if we can get your numbers, because we had the complaints, we'll deal with it. I'm not sure if the CEO of Kopanong is here, but Dr. Vita is going to be able to intervene. Let's get the numbers for you so that we're able to directly intervene to that challenge. Jubilee Hospital issues that are raised here, we also, if you can get your numbers, because indeed our MEC is an MEC not of the public sector, it's an MEC of health in Gauteng province, including the private sector. So Jubilee is one of our hospitals. So with the challenge that was experienced there, if you can get the numbers so that we're able to liaise with our colleagues that side, we are able to intervene to the challenge that it was raised. And all the complaints that are raised about our facilities, we're listening to them, but what I want to plead you on is that don't leave the facility if you are not saved. If you are not properly saved, we are existing for you. We are not doing a favor by rendering services. Demand the services, and we are committed to serve you because there is nobody who forced us to be in these facilities. We are here to serve. The only thing that I want to plead for, we have TB, MEC, as well as the chairperson of the committee. TB is a curable infection, but it's one of the conditions that is inflating the budget. We have a lot of people that are having TB, and we are leading as this district with TB. So much as we have to render services to the community, what I want to plead on, if you have been diagnosed with one of the chronic diseases, maybe your hypertension, diabetes, can you comply with the appointments? Can we take the treatment? Can we support those that are on TB treatment, particularly your mental health care patients? Because these patients, they come to us after they have relapsed, because that's another challenge that Sebokeng Hospital is facing. These patients, they come to us, we remedicate them, they are stable. After they are stable, we discharge them. There is nobody who's supporting them at home. Then automatically they come back to us. So which gives us this overcrowding. So much as we have a lot to do as the public sector, as a system, as clinics, as hospital, I want to plead to those that have been diagnosed to ensure that they get supported and they comply on treatment and they come during the appointment dates. Let I talk quickly about the Pello paper. I forgot the name of Mama that was talking about the situation that we had in Pello paper. I want to agree to that, surrender to it and raise my hands up. And I want to commit to you, MEC, that what happened this year in the Pello paper train, it won't happen in the next financial year. Because we know why people were there. People were there largely because of their eyesight, largely. We had a lot of arguments as a district executive. We went there, we proved it. And what is also was touching me there, we had people that are sleeping there, just for spectacles. Because there they diagnose you, manage you, and give you spectacles now, which is not how we operate. And I can actually confirm, Chair of the committee, that in Citibank, we have enough facilities that are supposed to provide up to the spectacles. We have 6 of them. We have since formed a task team that is working on the backlog, and I'm getting weekly updates. And I want to test this, if it's effective, by what is going to happen in the Pello paper in the next financial year. There is no reason why a person should wait for a year for spectacles. There's just no reason for that, because if now we diagnose you in January, Dr. Mfugeng says to you, you are supposed to wear spectacles. Then we give you spectacles in December. Trust me, the spectacles are not suitable for you, because now your eyesight has complicated. So we need to be as fast as much as we can in ensuring that after you are diagnosed, we give you a treatment. In this case, it's spectacles. So since the Pello paper, we have started that project of ensuring that the people of Citibank, they don't become beggars of healthcare services. They don't go and sleep in the cold train station looking for services. We're working for a caring government, and we'll make sure that we provide these services to the people that deserve them. So the other part that, there's the Upilong Clinic, the challenges in Sebokeng, I think we'll deal with those. It normally assists us if we get direct complaints. We want to know what has happened. I know that there are many theories that if you complain, this will happen and that will happen. I want to assure you that when you complain, nothing happens to you. Because, these other races, they don't mind complaining. It's us that are minding to complain. And the reason you get good services in certain places is because people are demanding for services. Let's demand for those services, because these complaints we're not allergic to them. We love them. We love them because they help us to improve. We are able to see which areas are still a problem. We have launched the I Serve with a Smile. If there are still a lot of attitude problems, then it means something is not working. And then we analyze them, we check which areas are mostly having complaints, then we go to those areas, we revive them. We go there, we dance with them, and then trust me, when we motivate them, what follows is a satisfied patient. So I want to plead that let's play our part in complying with treatment when we are in these facilities. These are our facilities. We are just workers there. We are owning the facilities. You can't leave with a complaint. You can't leave with a complaint, and our numbers are always available in all the walls in case somebody who's local is not able to assist you. We have been, okay, yes, somebody was talking about the Sebokeng hospital infrastructure. It's true. It's a very old hospital, but we're in the DMT yesterday with the district and the executive of Sebokeng Hospital. There is an overhaul project that has been approved in that hospital. So give it time. We have started in certain areas. Casualty is about to be done. But the whole hospital has been approved. And thank you to the changes that our MEC did in the infrastructure unit, because we have taken over control as health. So if the tap is leaking, a door is not fixed, I'm not going to say it's not my fault. It is my fault, because the powers have been given to the department. We know exactly what to do to solve these things. But what we're pleading for is a little bit of time, but definitely those that are going there, you've seen the passages that some had potholes. Those potholes are not there anymore. But we are just asking for your patience. The procurement issues, yes, it's a difficult one, that one, but we have something called CSD, Central Supply Database. Everybody who has business must be registered there if you want to operate and serve within government. I've taken note as well of the disabled in some facilities that are not well cared for. It's a criminal offense to do that. We can't do it. So we'll then try to strengthen and focus in those areas. The disabled are prioritized in our facilities, or I should say they should be prioritized. So if there are gaps here and there, what I want to plead for is that ngicela sireporte sizokhona ukuthi sikwazi uintervene kule zinto, because sometimes masikhuluma general kuba difficult intervene appropriately. So what I want to encourage you is that let's play our part. It's a collective effort. One last thing that I want to say before I sit. Before 1994, when we came, I think the government came in, because I'm analyzing the situation there, a lot of hospitals were closed because the theory was one. A lot of people will be healthy, a lot of people will be working, our people won't be sick. We don't need hospitals. We'll be focusing more in the Cuban method of prevention. But I want to tell you that the opposite is happening. Our people are sick and they need admission. So clearly something is wrong. We need to take care of ourselves. When we are diagnosed, let's comply with this treatment. On our side, when you come to these facilities, we want you to feel home. It should be a home away from home, and we are deliberate as management in ensuring that that experience, upon it is indeed improved. So with those few words, I'm saying these facilities belong to you. Let's work together in improving them and ensuring that they are providing good quality services. So those will be my responses to those questions. Those that I've left, I think my colleagues will then cover them up. Thank you so much.
Dumelang hape. Ke lebohele sebaka hape hore ke tlo le addressa ka di-issues tse le di boletseng tsa Sebokeng Hospital, mme ha ke sheba ke fumana hore hantle di pedi. Ke taba ya overcrowding le taba ya staffing. Ra tseba ebilane ke a dumela hore overcrowding ya etsahala ka matsatsi ohle, mme ke batla hore ke tle ke re overcrowding ke yona e leading to shortage of staff. Akere ka hore setjhaba se hodile ba gaetsho re dumele ntate o e beile hantle na bua mang. Sepetlele sa lona ha e sale e le sona se le sekana ha se so oketswe, mare ra tseba hore setjhaba sona se hodile 3-4 times ho tloa ka 1980 ha ne sepetlele se ahwa. But re ke bolele he ntate o buile ka sekgowa mohlomong ba sa kgonang ho utlwisisa hore na ho etsahalang jwale lefapheng la bophelo bo botle hona jwale. A ke ra se tseba sepetlele sa ne sa Johan Hensi ra se tseba le bue tle ke tseba hore ha le tswa mona e be le kgotsofetse ha o thuso le tle e be ha la utlwa nix. Sepetlele sa Johan Hensi ra tseba entse le clinic fela ha jwale a ke re mara ntate o boletse ntate sonwa bo hore ba tlotswa se tlo khutlela morao e ba sepetlele hape se nang le dibete tse 240. Ra utlwisisa batho ba haeso sepetlele sa Johannes se tlo ba sepetlele hape. So ra utlwisisa hore jwale kaofela batho ba bokelanang Sebokeng mane casualty ba dula di hora ba eme jwale ba tla ba sa bana le sepetlele se seng hape mo ba tla kgonang ho ya teng ba thusuwe. Ra utlwisisa so project e sentse tlo qala haufinyana tje. Wa bona? So overcrowding itla etsa. And hape o buile ka mental health, akere bana ba boboko ra tseba hore hae mona bothata haholo ke ntwe na ya nyaope ena akere. So bana ba kena ba tswa sepetlele ba kena ba tswa, mme re setsa mathata overcrowding hape mo casualty mane. Mare mmuso hape o dumetse hore a hela ward fela ya mahloko a boko ya 64 e tlo qala haufinyana le yona 64 beds ya mahloko a boko. So ra e bona hore casualty ya rona jwale sentse e ba free, ra e elellwa haufinyana e tla ba free. Mme le staffing hona jwale ntse se shebuwa hobane jwale ha bakudi ba ya hodimo number ya bona, staffing ha ntse le sane sa kgalekgale ha se kgone. Ene re a bona hape hore batho ba rona ba sa ba kula haholo akere ha o sa tshwana le pele batho ba kula hona jwale. So ha ba kula haholo ba batla kore ntho e re bitsa acuity, mara kore ba batla tshebetso e ngata motho a le mong. So o itlhela hore ngaka le manese ba spenda nako e telele mo mothong a le mong, which was not the case 40 years ago ha ne Sebokeng hospital e bulwa. So re utlwisiseng ntate o tsholo hore ha re emeng hanyane fela dintho di a loka, motšhini o so qadile ho pompa jwale o re isang pele in terms of ditletlebo tsa rona ka overcrowding le staffing tsa Sebokeng. They are going to be addressed because ke batla le tle le elelo la ka ra increase manese ra tlatsa casualty. Ha sepetlele se tletse ho tlo etsahala hobane se dula se tletse sepetlele sa lona. MEC ya kana mpha batho ba 50 ke ba kenye casualty ya lona, mara ha hona sebaka sepetlele se tletse ba tlo sebetsa kae manese ao hobane jwale ba tlo etsa overcrowding e wese lo feta ka ra casualty. Empa taba ya Johannes e etseditswe hona hore e release pressure hodima Sebokeng hospital. Mme ke manki lulu ke tla reflecta fela on issue ya hore ngwana o latloa bophelong aya Johannes mme aya Sebokeng aya kopano. Ke tla ofa Dr. Mofokeng kwane ema doctor ba o bona ke Dr. Mofokeng ke na doctor a moholo wa casualty a go ikopanye le yena hobane ha go utlwisise hore na ngwana ha na sa le Sebokeng hobane ngana tlamiwa hore a tloswe Sebokeng a ye kopanong hape mme a fella mo ke ntwe bohloko haholo mme we apologize. Mara kopana le yena tle re sebe ho bona hore na ho etsa etse nna ka ke tshola ne ke bua le lona session ena kore re kgone ho lokisa ho ska tla bana ba bang hape ba tswa Levaeng ba thale kae le kae ba tla Sebokeng ha thutsa mao ya kopano re bona hore na phoso e la ba kae, phoso eo re tsebe ho ilokisa. Ke nana hore ke feletse ha kana ka di issues tsa Sebokeng. Ke a leboha.
Thank you, Chairperson and the committee. Greetings to the community of the VAL and MEC and the Chairperson. Yeah, I'm just going to talk on the issues that have been highlighted. There was an issue raised on the problems of medicine not being available in our clinics and a patient being sent from one clinic to the other. Just to highlight that we have noted that not only from today's complaint, but from other complaints before, and we are working on that as a department in terms of how we are going to streamline our referral system and our referral policy as patients are being sent to the lower level of care for follow-up treatment, whether it's chronic medication or others. What we've realized is that there is no proper coordination. So we are now working with family physicians in each and every district, not only Sebokeng, so that there is proper coordination. As you are down-referred from the clinic, from the hospital to the clinic, how do you then get your medication going forward, even if it's a 6 months repeat, so that when you go to a designated clinic, you always find your medication available there using also the CCMDD program that we are rendering as a department. And the other issues that are relating to infrastructure, we are, as it's been noted, as a department, working on a focused infrastructure revitalization within our clinics and our hospitals. And unfortunately, yes, it's been highlighted here that there are those clinics that still belong to the municipality. But as a department, we have already gone ahead with a presentation to the Treasury in terms of us as a province, how we are going to take those clinics over and be able to manage them. Because we have acknowledged the problems that exist as we are running with the municipality. But as well, before we take these clinics over, we are collaborating with the municipality. Wherever there are challenges, we try to intervene as a department. We do not say this is not our clinic, and our MEC is very strict on that to make sure, because as the department, we are the custodian of healthcare. As I'm speaking to you right now, we have a challenge that exists in Tembisa, in a local municipality clinic. But we have sent our team there to go and sort out the problems that are there, because really we are patient-centered as the Department of Health. And then there is issues of overcrowding. The issues of overcrowding, we are working on them as a department, so that not only expanding the services, but how do we are creating efficiencies. Part of that is the CCMDD that we have started, the one patient, one file that we are implementing, and digitalization, and the electronic systems that we are putting now in the hospital, assisting the staff that is there. And as a department, what we have had in the previous years as part of the problems that the specialized trained nurses, and because that program was stopped, but we have currently revived it, and we are working with universities. We're working with the Nursing Council to ensure that we start training these nurses so that the specialized care that we are providing, it's really brought back to the community. And part of what the complaints MEC were talking about were equality related issues. And as a department, we are focused on quality. We are making sure that we comply with all the quality standards. We are currently ensuring that our hospitals and our staff are trained on quality care standards, and we ensure that our clinics, they meet those standards, and our hospital meets those standards. And so we have a quality department in the department, quality unit, that we are rendering that service through it, but it's work in progress that we have embarked on as a department. To note as well is the issues of the people with disability, especially the blind. We've noted that. I think we will discuss with our communications department so that we can see how we then are able to help them, and in as far as them, because part of our quality, we are promoting patients' privacy. So we really will, as a department, look into that to make sure that we support people living with disability, and ensure that as we have a project under the MEC to ensure also that our hospitals meet all the standards of occupational health and safety for our staff and for our patients. So that project is running fast in the department. And the issues of I think the issue MEC of Jubilee, Mr. Sonwabo has partially touched it, but we are also ensuring that we are working with Jubilee. There's a special team that has been sent to Jubilee to work at Jubilee to improve the services asked by the audience.
Thanks, Dr. Snabe, you did indeed. Chair, I think we have tried to answer all the questions. Communicate now, you will be, as of today, you are going to work with Dr. Victor. In all the things, problems that you have encountered, he is going to make sure that whatever assistance that is related to health that you need, he is helping you. But besides that, we are going to work with you, Tina, as a department, to sort out the problem that has happened Kopanong. I know the lawyers are busy with it, the internal lawyers in the department, Dr. Slepe. So I think Nandipa is going to work with you on the issue of Kopanong. On our side as a department, we will second the lawyer, Nandipa, to deal with that problem so that your lawyers and Nandipa can have a discussion on how best can we sort out the problem that you went through. But at the same time, the clinical side, Dr. Victor, you will report to Babu Slepe all the processes that he will be doing with you. Because myself and Dr. Slepe were trying to organize that now doctors must go on site. What Cubans are doing, Chair, if there is a problem where I am, I'm sure you'll find us with a mobile clinic. In the mobile, there is a doctor and their nurses. And we're taking out the doctors from the districts and nurses because we don't have capacity now. On site immediately. So that's the process. It's a project that we have designed ourselves, no slepes minge nyao. We didn't even want to say we'll make it official because when we have a problem of overcrowding. We are still waiting, even if Premier gives us that file, Dr. Slepe, that I've been complaining about, it's not going to help us with the problem, a capacity that we have. So it's not enough nurses, we don't have enough nurses. I'm coming from Steve Biko as we speak, we don't have enough porters, we don't have enough nurses, but it's worse than nurses, Yona. So that's why we're prioritizing it. Any little amount of money that we have, we want to ensure that now we fill in the posts, Zama nurses in all the hospitals, because it's a critical problem that we're experiencing. On OHS with Dr. Snabe, we've assigned to Dr. Snabe, not Dr. Snabe, to deal with issues in all the hospitals and even in the clinics. Now it's going to help us ama clinics to comply once all those clinics finalize the process a provincialization. Same as this one, Yama ambulance. Ubabu Dr. Slepe again, sekalile on the referral policy. Ukuzamu implement that policy Tembisa. Because Tembisa is overcrowded. What we have agreed is to make sure that there is an ambulance that takes some of the patients that goes to Tembisa. Immediately, Mabefika referred them to the clinics that are in Tembisa, in the communities. Because some want to go to Tembisa instead of going to the clinics. So that we don't have this pillar to post that is being done, then patients end up dying on the road. And we have qualified nurses and doctors that are managing that process. So that process, I think, Babu Slepe must come here. Because we've started it in Nekuru Lane. I think we must bring it here so that we can have a stationed ambulance like we have done at Tembisa that waits outside the door at Sebokeng. If they're supposed to go to Kopanong, it's not a hassle. We just take a person there. But that person, when they go with a doctor and a nurse that must take them to and transfer them properly to the nurses at Sebokeng or Kopanong. So we'll bring it this side so that it becomes a smooth exercise chair that is being done because we were testing it at Tembisa and I think it's going to work. On Johan Haynes, indeed, want to make it a hospital. We're at an advanced stage. We need 4 hospitals. Pity that we closed it at that time thinking that is not going to be utilized. Now the communities are more, we have more people that are demanding health services. So hence we are going to do that. And it's at an advanced stage process here to Chair. Thank you so much, Chair, for having us. Let's hope we have tried to clarify, but the team will still be here if there are other things that are remaining. Thanks.
Ya le lona ipethele matsoho. Ke batla le ipethele matsoho because le kgonne ntsha di nnete tse, akere? Because bophelo bo ke bophelo ba lona. Ale le sa ipui, gona le monyetla wa re le ipue. Ke lona le ikgobatsang, akere bana beso. So ke rata o le leboa. And then go bofelong MEC, I think as I was listening, there were fewer things which I thought the department they might want to look closer to. One of them is monitoring and evaluation of these programmatic interventions that we are coming with. Because now we're going to the framework, patient satisfaction framework. I smile, I serve with a smile. Mara is not a monitoring framework. I get one generally, the necessary their oath of service. Marona le mo lorong o kra le ro o mong ona le pelonyane ngwa bolotsana. I get. So if the department can assist our community just to monitor to ensure that beyond the framework those intervention finds expression. Recently the cases of people by lor mbarno hey negile go clinicing this is how I was treated. Number 2, bongata ba lona ba bang le lla hey our health establishments di dinyenyane. And I think the MEC makes that point ore ka nnete a number of these clinics were built over previous eras. So there's a need for additional health stock. I know the MEC has progressively moved towards taking some of the responsibilities. Tse lor ne di filwe lefapha le leng le loreng le shebane le dikago tsa mafapha rona a farologaneng a golomente. So I think maybe we must intensify and maybe periodically just communicate what are some of the commitments towards the expansion of some of these health establishments. And I think you can also link that issue to Ntoya the mobile clinics, coordination of a mobile clinics in that lab. Because Rutule di lomolo tse di reng mobile clinics la di tlile nako nngwe a ona medication o rileng or a di fitlhi ka nako and so on. And then number 3, there's a lady who speaks ka ke mme princess wa bua ngore hey what 25 it's vast rona ba ba mara go diplotong so ke ntshwele ya rural health. What kind of programs are we running or campaigns to educate our people to know how to access these health services? Because bon khono bon tate mogolo ba le gore ba dula ko maplaseng nako nngwe a bana kitso akere so re batla gore le bona re thusane le bona gore ba kgone go fitlhella ditshebeletso tse tsa lefapha tse. So if we can just strengthen that part, so that when mobile clinics also go there, at least there's also an element of health promotion as well. And then ke tswentse ke kgang e nngwe ya mme o mong wa go Jubilee. So I'm happy that this lab you mentioned it, or there's a team that has now been designated. Because meolo one the maternity ward. Now going because of a limitation of space, you find that people who might need the psychosocial support are mixed with people who are normal and have just given their babies. It sort of poses as a risk. So we might just want to examine and assess, program and management in that specific area so that we don't have a recurrence of what May would have explained there. And then, ntwele ya batho ba le gore ba phela ka bofokodi, people with disabilities. Lord, it's one such issue Lord, we may just need to look. You know, whether in our health establishments, is there anything that interacts or any people who are stationed at the entrance of these facilities to really navigate people with disabilities through the entirety of the facility and the processes that they must follow, you know. Because if we don't do that, Motomo might feel, or I'm not receiving much, you know, support or help in that area. So if we can just look into that. And then, I agree with that. I guess I'm going to get that man. I'm going to get that or get me Google. Who says na go re ruta batho ba ko rona MEC to know their rights. Rona le patient rights charter, ona le I serve with a smile, ona le batho pele principles, so ona le patient satisfaction survey. But the critical stakeholder at times we must bring closer. Ke bona di nurses, ke bona to monitor, to play oversight. Again, so that we don't have some of these anomalous situations. Mara ke itagere that program of continuously educating our healthcare practitioners is important. Agere na go ba ba maitebala wa bona. Ore ke na le 15 years ke le mo facility ya ke itse system. And there's always a need for continuous professional development. How ka tloela nako nngwe itse nako nngwe re na le gore how ka tloela bodulo. Onna complacent. You know. Ore complacency ka sekgowa bana le gore it brews contempt. How ka tloela ra nna ke motho wa mo. System tse di raniwa so. O lo kra ile gore o se tena mo setšhabeng. Because about dilo the way we're not. So it's mostly important that we continuously train and re-educate some of our healthcare practitioners. And then there are some of the complaints already against. Mari, we have never received the feedback on these complaints. And our well goes complaint, they are not being responded to. And maybe now that we have got the I Serve with a Smile campaign as well as the patient experience to care frameworks, we will also be able to monitor feedback because feedback is important. You know, that is why look over to pay. That is why even in the constitution or reasons must be provided for specific administrative decisions. If a patient will come because of a referral arrangement, we should be able to explain. If patient is suggested, we should be able to give feedback. So I think we may need to just strengthen that part as well. I think those are some of the issues which I thought they should constitute the focal points on the part of the department. And I suppose even on the part of the committee, as we do our oversight, we will also want to monitor those specific areas, including some of the issues that will have been expressed in this meeting. Marmaholo, kerato le leboa ke re ko bofello. Or you were such a wonderful audience. Le kgonno dula la mamela, la ra le filwe monyetla la kgono ipua. Rona matsapa re itemolang ona ke ya mafe. Again. And ke rata o itagere, this would not be the last time. Re tla ka mo bofello, ma se la ntla re tla kere. And a se la bofello re tla ka. So re batlo re le thusane le committee e. Gore e kgono sheba gore manane wa lefapha tsamaya ka mokgolo re ntshwantsa tsamaya ka ona kere. And ke leboe hape le lefapha led by the MEC for having graced this occasion, for having interacted le badudi ba ka mara regional rona ya Valley mara badudi para province ya rona ya Gauteng, because a ke rutlwile o na le ba ile gore ba tswa ko bo Hammanskraal, o na le ba ile gore ba tswa ko bo Ekurhuleni, le lona re batlo le leboa gore le kgonne go fitlha. Ke leboe maloko a committee for being available for this work. It's a thankless work, but we have to do it nonetheless, because batho ba re kentseng mo ditulong tse re leng mo tsone ke ba. So re seba setšhaba se. Ke leboe gape le bomme le bontate ba ba thusaneng le rona, whether ke ba di-sound-o, ke leboe le mme le ntate ba ile gore ba re thusitse ka sign interpretation, ke leboe le ba ile gore ba ko morago ba ile gore ne ba le translator la le utlweletsa akere. Ke leboe le bomme, ke bone bomme ba bangata ba ma security a ke itse gore ditsotsi nke be di tsene mo ne ba tla kgona go thusa, mara ba leboe akere re ba leboe le bone. Ke leboe mongwe le mongwe o le gore o nnile le karolo mo lenaneong la rona ka jeko. Ko leboe doctor from Cuba, re na le doctor from Cuba, emela ba bone doctor. If you can stand up, we want them to see you akere. This 1 year. Oh, wonderful. So this is an ultimate act of sacrifice. I get it. That somebody leaves their country of birth to come and aid our health system. We don't take it for granted. So we really want to appreciate the mainstay of your servitude in our country. We really want to appreciate. Kobo fellong ke re batho ba mo hae kopano ya rona e fitlhile mo bokhutlong. Re kopa gore le ska tsamaya akere rona re committee fela le gore le boebe le phatlalla le tlo fiwa diamaleng akere, mara le melle ba tlo simolla ko morago ko ba lefe le ska emella ba tlo le tlisetsa tsona ntse le ntse mo fatshe akere. Ro simolla ka bonkgono a re batle modumo rato le leboa re modimo a le baballe ka jeko, a le baballe ka moso le matsatsi a tlang akere. Re leboile kopano ya rona e fedile.
My phone is low, let me show you. This is my baby.